Dysfunction responses to injury. Core concept. Clarified, the cardiovascular system has a limited number of stereotyped responses to injury. These responses are predictable, mechanistic, and form the basis of most cardiac pathology. High-yield responses include hypertrophy, pressure or volume overload, dilation, contractile dysfunction, conduction disturbances, vascular remodeling, congestion and edema, myocardial necrosis and fibrosis. Exam tip. Phase 2 loves asking you to identify which type of overload, pressure versus volume, produced a given hypertrophy pattern. Heart failure. Core concept. Heart failure is a progressive clinical syndrome, not a single event. It reflects the heart's inability to maintain adequate forward flow and/or prevent venous congestion. Two major failure modes. 1. Low output heart failure, forward failure. Impaired ventricular ejection. Arterial pressure. Tissue perfusion. Clinical signs: lethargy, syncope, hypertension, weakness.
2.
Congestive heart failure, backward failure. Inadequate emptying of venous reservoirs. Venous pressure. Fluid accumulation in tissues and cavities. Clinical signs: ascites, pleural effusion, pulmonary edema. Exam trap. Low output and congestive failure often coexist. Don't treat them as mutually exclusive. Congestive heart failure, CHF. Core concept. CHF results from systolic failure, diastolic failure, or both. Systolic failure. Impaired contraction. Stroke volume. Cardiac output. Often due to dilated cardiomyopathy, myocarditis, infarction. Diastolic failure. Impaired filling. Stiff ventricles. Normal contractility but preload. Seen in hypertrophic cardiomyopathy, fibrosis, pericardial disease. Result: stroke volume. CO. Arterial blood pressure, neurohormonal activation, worsening disease. Right-sided VS, left-sided CHF. Right-sided CHF. Systemic congestion. Ascites. Hepatic congestion, nutmeg liver. Peripheral edema. Jugular distension. Hydropericardium. Left-sided CHF. Pulmonary congestion. Pulmonary edema. Dyspnea, tachypnea. Exercise intolerance. Cough, dogs. Species note. Small animals, pleural effusion usually indicates bilateral CHF. Cats, pleural effusion can occur with left-sided CHF alone. Horses, edema often appears in dependent regions, ventral edema. Exam tip. Always specify which circulation is congested, systemic vs pulmonary. Pathophysiology of heart failure. Core concept. Chronic overload, hypertrophy, ischemia, myocyte death, fibrosis, progressive, irreversible failure. Mechanistic sequence: high yield. Pressure or volume overload, cardiomyocyte hypertrophy, increased wall stress. Hypertrophied myocardium outgrows its blood supply, relative ischemia, increased oxygen demand, MVO. Ischemia, myocyte injury and death, loss of contractile proteins, myocyte dropout. Replacement, fibrosis, stiff ventricles, impaired diastolic filling. Progression to systolic plus diastolic dysfunction, reduced CO, neurohormonal activation, RAAS, sympathetic, further hypertrophy and fibrosis. Exam trap. Hypertrophy is initially compensatory but becomes maladaptive once oxygen supply cannot meet demand. Cardiac syncope. Core concept. A sudden, transient loss of consciousness due to abrupt reduction in cerebral perfusion. Causes include severe arrhythmias, ventricular fibrillation, asystole, high-grade AV block, massive myocardial necrosis, reflex vagal inhibition, e.g., intestinal obstruction. Exam tip. Syncope is not the same as seizure, no tonic-clonic activity, rapid recovery, often triggered by exertion or excitement. Medium White Star Extra ACVP Phase 2 exam tips for this section. Hypertrophy patterns. Pressure overload, concentric. Volume overload eccentric. Left vs right CHF. Always identify which circulation is congested. Fibrosis equals irreversible once present. Diastolic dysfunction is permanent. Neurohormonal activation, RAAS, sympathetic, is central to progression, mention it in essays. Myocyte dropout is a hallmark of chronic heart failure. Syncope is an electrical or perfusion problem, not a structural one. CHF is a syndrome, not a diagnosis, always specify the underlying cause. Disturbances of growth. Myocardial hypertrophy. Core concept, hypertrophy equals increased cell size, not number. Occurs when workload exceeds normal capacity. 2 anatomic forms. 1. Eccentric hypertrophy, volume overload. Dilated chambers. Normal or thin walls. New sarcomas added in series. Causes, valvular insufficiency, shunts, anemia, high output states. 2. Concentric hypertrophy, pressure overload. Thickened walls. Small chambers. New sarcomas added in parallel. Causes, systemic hypertension, pulmonary hypertension, aortic pulmonic stenosis. Species note. Hyperthyroid cats develop reversible hypertrophy due to increased synthesis of contractile proteins. 3 stages of hypertrophy, exam focused. Initiation. Myocytes enlarge. Increased protein synthesis. Stable hyperfunction. Compensatory phase. Maintains CO. Deterioration. Myocyte degeneration. Fibrosis. Loss of contractility. Progression to CHF. Microscopic hallmark. Enlarged myocytes with large, hyperchromatic nuclei, boxcar nuclei. Exam trap. Hypertrophy becomes maladaptive when oxygen demand exceeds supply, ischemia, myocyte death. Physiologic atrophy. Occurs in confined animals, reduced workload. Chronic CHF, decompensation. Mechanism. Initially hypertrophy, frank Starling. Excessive stretch loss of contractile proteins, myocyte atrophy. Exam tip. Atrophy in CHF is a late-stage change and indicates poor prognosis. Neoplastic transformation. Primary myocardial tumors, rare. Rhabdomyoma. Rhabdomyosarcoma. Fibrosarcoma, rare. Secondary tumors, common. Lymphoma, especially bovine, feline. Metastatic carcinomas. Hemangiosarcoma, dogs, right atrium. Exam trap, right atrial hemangiosarcoma, hemopericardium, sudden death. Cell degeneration and death. Core concept, myocardial degeneration and necrosis have a limited morphological vocabulary, so many causes look similar histologically. Common degenerative changes. Lipofuncinosis. Fatty degeneration. Myocytolysis. Vacuolar degeneration. Why diagnosis is hard. Many toxins, metabolic disorders, and ischemic injuries produce identical lesions. Myocardial necrosis often resembles myocarditis because both have leukocytic infiltration. Exam trap. A small lesion in the conduction system can be fatal, while widespread myocarditis may be clinically silent. Cardiotoxicity. Mechanisms of cardiotoxic injury. Exaggerated pharmacologic effects. Depressed myocardial function. Direct myocyte injury. Hypersensitivity reactions. Common veterinary cardiotoxins. Ionophores, horses, cattle, mitochondrial dysfunction, necrosis. Vitamin E, selenium deficiency, oxidative damage, white muscle disease. Anthracyclines, doxorubicin, free radicals, myofibrillar loss. Gossipal, pigs, impaired energy metabolism. Heart-brain syndrome, dogs, catecholamine surge contraction band necrosis. Toxic plants, Acacia georgini, Dicopetalum cymosum. Exam tip. ionophore toxicity produces multifocal necrosis, especially in horses, most sensitive species. Oncotic necrosis. Mechanism. Membrane injury, permeability, water influx, cell swelling, oncosis, membrane rupture, necrosis. Histologic sequence. Myocyte swelling. Loss of striations. Hyperiocinophilia. Nuclear pycnosis, karyolysis. Leukocytic infiltration. Phagocytosis of debris. Fibroblast proliferation, collagen deposition, scar. Key point: regeneration is minimal in mammals because myocytes are terminally differentiated. Continuous contraction disrupts regenerative processes. Only neonatal animals and some species, birds, amphibians, fish, show limited regeneration. Exam trap, collapsed sarcolemmal tubes, ghost fibers, are classic for old necrotic lesions. Medium white star extra ACVP phase 2 exam tips for this section. Hypertrophy patterns are one of the most testable concepts. Always specify pressure versus volume overload. Myocardial necrosis not equal to myocarditis. Inflammation can be secondary. Ionophore toxicity, horses, cattle, poultry, species sensitivity matters. Right atrial hemangiosarcoma is the #1 cause of hemopericardium in dogs. Fibrosis equals irreversible. Always mention this in essays. Conduction system lesions can be fatal even if microscopic. Degeneration is nonspecific. Avoid overinterpreting histology without clinical context. Vitamin E selenium deficiency, pale streaks in skeletal and cardiac muscle, white muscle disease. Contraction band necrosis equals catecholamine excess, stress, trauma, pheochromocytoma. Apoptosis. Core concept: clarified apoptosis equals programmed cell death without inflammation. It is increasingly recognized as a contributor to myocardial injury in cardiac development, ischemia and reperfusion. Hypoxia. Pressure overload, hypertrophy. Cardiotoxicity, especially oxidative stress. Mechanism. Triggered by oxygen-free radicals, mitochondrial pathways, or death receptors. Cells shrink, form apoptotic bodies, phagocytosed. No inflammation and no fibrosis. Exam tip: apoptosis is subtle histologically. Look for shrunken, intensely eosinophilic cells with fragmented nuclei, not the swelling seen in necrosis. Fatty infiltration. Core concept: increased adipocytes between myofibers, not lipid inside myocytes. Occurs with obesity. Age. Some breeds species normally have more epicardial fat. Gross appearance: yellow, irregular fat streaks infiltrating myocardium. Atria and RV most affected. Exam trap: fatty infiltration not equal to fatty degeneration. One is interstitial fat, the other is intracellular lipid. Fatty degeneration, fatty change. Core concept: accumulation of lipid droplets inside myocytes. Microscopic features: clear vacuoles in sarcoplasm, paraffin sections. Positive with lipid stains, frozen sections. Causes: severe anemia, toxemia, copper deficiency, hypoxia. Systemic metabolic disorders. Exam tip: much more common in liver and kidney than heart, so if you see it in myocardium, think of systemic disease. Hydropic degeneration. Core concept: intracellular water accumulation due to injury to sarcoplasmic reticulum or mitochondria. Classic causes: anthracyclines, doxorubicin, antiretroviral drugs, AZT, chronic passive congestion. Microscopic features: extensive vacuolization of sarcoplasm, dilated sarcoplasmic reticulum, mitochondrial swelling, disrupted cristae, myelin figures, membrane debris. Clinical consequence: cardiac dilation, ascites, CHF. Exam trap: hydropic degeneration is reversible early, unlike necrosis. Myofibrillar degeneration, myocytolysis. Core concept, sublethal injury with loss of myofibrils. Microscopic features. Pale eosinophilic sarcoplasm. Loss of cross striations. Myofibrillar dissolution ultrastructurally. Causes. Furazolidone toxicity, birds. Potassium deficiency, rats. Exam tip. This lesion is not necrosis, nuclei remain intact, and there is no inflammation. Lipofuscinosis, brown atrophy. Core concept, accumulation of lipofuscin pigment, wear and tear pigment, in myocytes. Occurs in aged animals. Cachexia. Hereditary in Ayrshire cattle. Gross appearance. Brown discoloration of myocardium. Microscopic appearance. Yellow-brown granules at nuclear poles. Lysosomal residual bodies. Exam trap. Lipofuscin is not pathologic by itself, it reflects chronic oxidative stress. Mineralization. Core concept, dystrophic or metastatic deposition of calcium in myocardium. Causes. Vitamin E, selenium deficiency, white muscle disease. Vitamin D toxicity. Calcinogenic plants, e.g., Cestrum diurnum, Solanum malacoxylon. Hereditary calcinosis, mice. Cardiomyopathy in hamsters. Spontaneous calcification in aged rats, guinea pigs. Exam tip. White muscle disease lesions are bilaterally symmetrical, pale, gritty, and subepicardial subendocardial. Myocardial necrosis. Core concept, final common pathway of many injuries, nutritional, toxic, ischemic, metabolic, hereditary, or physical. Gross appearance. Early, pale. Later, yellow-white, dry, gritty, mineralization. Distribution, focal, multifocal, or diffuse. Common sites, LV papillary muscles, subendocardial myocardium. Why these sites? They are most vulnerable to ischemia due to high metabolic demand and lowest perfusion. Microscopic patterns of necrosis, exam critical. 1. Hyaline, coagulative, necrosis. Swollen, hypereosinophilic fibers. Loss of striations. Pycnotic nuclei. Calcified mitochondria, basophilic granules. 2. Contraction band necrosis. Hypercontracted fibers. Transverse eosinophilic bands. Caused by catecholamine excess. Stress. Trauma. Pheochromocytoma. Heart-brain syndrome. 3. Ischemic, coagulative, necrosis. Relaxed fibers. Loss of nuclei. Seen in infarcts. Exam trap. Contraction band necrosis equals catecholamines, not ischemia. Timeline of necrosis and healing. 0 to 24 hours. Swelling, hyperiocinophilia. Early nuclear changes. 24 to 48 hours. Macrophages plus few neutrophils. Phagocytosis of debris. Days, weeks. Fibroblast proliferation. Collagen deposition. Formation of scar. Gross appearance of healed lesions. White, firm, contracted scars. Outcomes of myocardial necrosis. Acute death from extensive necrosis. Arrhythmic death if conduction system involved. Chronic CHF from scarring and dilation. Incidental fibrosis if minimal damage. Exam tip. A tiny lesion in the AV node or bundle branches can be fatal. Medium white star extra ACVP phase 2 exam tips for this section. Distinguish fatty infiltration, interstitial, from fatty degeneration, intracellular. Hydropic degeneration is reversible, necrosis is not. Contraction band necrosis equals catecholamines, a favorite exam point. White muscle disease lesions are gritty due to mineralization. Papillary muscles are the most ischemia-sensitive region. Myocardial necrosis versus myocarditis. Early necrosis has inflammation, don't overcall myocarditis. Fibrosis equals irreversible, always mention this in essays. Lipofuscin is normal in aged animals, don't misinterpret as pathology. Ionophore toxicity produces multifocal necrosis with mitochondrial swelling. Inflammation. Myocarditis. Core concept: clarified myocarditis equals inflammation of the myocardium, usually due to hematogenous spread of infectious agents. It is often part of a systemic disease, not a primary cardiac disease. Key point: the myocardium has limited ways to respond, so many infectious agents produce similar patterns. A favorite ACVP exam trap. Types of myocarditis: pattern recognition, high yield. 1. Suppurative, neutrophilic, myocarditis. Cause: pyogenic bacteria. Mechanism: bacteria lodge in myocardium via septic emboli. Most commonly from vegetative endocarditis on mitral or aortic valves. Leads to septic infarcts, abscesses. Gross, pale, disseminated foci micro, neutrophils plus necrotic myocytes. Exam tip: if you see abscesses in myocardium, always look for valvular endocarditis as the source. 2. Necrotizing myocarditis. Cause: highly virulent viruses, toxins, ischemia. Mechanism: direct myocyte destruction. Exam trap: necrosis with inflammation not equal to myocarditis alone. Inflammation may be secondary to necrosis. 3. Hemorrhagic myocarditis. Cause: clostridial infections, anthrax, endotoxemia, some viral infections. Gross, dark red streaks or patches. 4. Lymphocytic myocarditis. Cause: viral infections, e.g., parvovirus in dogs, coxsackie in humans. Immune-mediated disease. Mechanism: often immune-mediated, not direct viral cytolysis. Exam tip: lymphocytic myocarditis in dogs. Think parvovirus, but confirm with crypt necrosis in intestine. 5. Eosinophilic myocarditis. Cause: parasitic infections, hypersensitivity reactions. Idiopathic in some species. Exam tip: eosinophils in myocardium. Think parasites, e.g., sarcocystis, toxoplasma, neospora. Outcomes of myocarditis: complete resolution, residual myocardial scars, progressive myocardial damage, dilated cardiomyopathy, DCM, especially in viral myocarditis, seen in experimental coxsackie models. Exam trap: myocarditis can evolve into secondary DCM, especially when fibrosis disrupts systolic function. Host factors that worsen viral myocarditis, high yield. From coxsackie studies. Young age, male sex, pregnancy, poor nutrition, whole body radiation, cold stress, alcohol ingestion, exercise, cortisone administration. Mechanism: much of the damage is immune-mediated, T-cell driven, rather than direct viral injury. Exam tip: if myocarditis severity varies widely, think host immune response, not pathogen load. Cardiac conduction system. Core concept: injury to the conduction system causes arrhythmias, which may be fatal even when lesions are microscopic. Why this matters: the conduction system is rarely examined histologically, so lesions are often underdiagnosed. Types of conduction system injury: degeneration, cell death, necrosis or apoptosis, inflammation, fibrosis. Consequences: atrial or ventricular arrhythmias, heart block, sudden death, syncope. Exam tip: a tiny lesion in the AV node or bundle branches can cause fatal arrhythmia. Size does not correlate with severity. When conduction system lesions are seen: myocarditis, cardiomyopathies, ischemia, fibrosis, age-related or post-inflammatory, toxins, inherited conduction disorders. Exam trap: Conduction system fibrosis in older dogs is common and may explain unexplained arrhythmias. Medium White Star Extra ACVP Phase 2 exam tips for this section. Always classify myocarditis by inflammatory cell type. This is the key to narrowing the cause. Suppurative myocarditis, think septic emboli from valvular endocarditis. Lymphocytic myocarditis is often immune-mediated, not direct viral cytolysis. Eosinophilic myocarditis, think parasites or hypersensitivity. Myocarditis can progress to secondary DCM, mention this in essays. Conduction system lesions can be microscopic but lethal. Myocarditis versus necrosis. Early necrosis has inflammation, don't overcall myocarditis. Always consider host factors when severity varies: young, stressed, immunosuppressed animals. If you see papillary muscle necrosis, think ischemia, not myocarditis. Endocardium and heart valves. Disturbances of circulation. Hemorrhage. Core concept: endocardial hemorrhage is common and usually nonspecific. Causes include trauma, blunt chest injury, septicemia, especially endotoxin-producing bacteria, agonal changes at death, very common. Exam tip: agonal endocardial hemorrhage is not pathologic, don't overinterpret it. Look for distribution: random petechiae ecchymoses equals agonal, patterned lesions equals pathology. Disturbances of growth. Valvular anomalies and dysplasia. Core concept: congenital malformations of valves arise from failure of normal valvular development, endocardial cushion defects. Common examples, species relevant. Tricuspid dysplasia, dogs, especially Labrador retrievers. Mitral valve dysplasia, cats. Pulmonic stenosis, dogs. Aortic stenosis, large breed dogs, pigs. Exam tip: congenital valvular lesions, eccentric or concentric hypertrophy depending on whether they cause volume or pressure overload. Cellular degeneration and death. Myxomatous valvular degeneration, endocardiosis. You'll cover this in detail later, but here's the high-yield anchor. Core concept: a chronic, degenerative change of AV valves, especially mitral, in older small breed dogs. Mechanism: expansion of the spongiosa with myxoid material leaflet thickening prolapse regurgitation. Exam tip: this is the most common cardiac disease in dogs, always mention it when discussing chronic valvular pathology. Mineralization. Core concept: endocardial mineralization occurs when calcium deposits in damaged or metabolically altered tissue. Causes include vitamin D toxicity, calcinogenic plants, cattle, e.g., Cestrum diurnum, Solanum malacoxylon, calcium phosphorus imbalance, John's disease, chronic granulomatous inflammation, metabolic derangements. Why endocardium and elastic arteries? They contain abundant elastic fibers, which bind calcium readily. Exam trap: mineralization is dystrophic, normal Ca² levels, in most cases except vitamin D toxicity, metastatic. Inflammation. Inflammation of the endocardium or valves follows the same principles as elsewhere. Acute neutrophils, chronic lymphocytes, macrophages, fibrosis. Immune-mediated or infectious causes. Exam tip: endocarditis, vegetative, is covered later, but remember. Low pressure side of valves equals vegetations. High pressure side equals jet lesions. Pericardium and epicardium. Core concept: these structures respond to injury with a limited set of patterns. Hemorrhage. Effusions, hydropericardium, hemopericardium, chylopericardium. Developmental anomalies. Serous atrophy of fat. Inflammation, pericarditis, epicarditis. Exam tip: hardware disease, traumatic reticuloperitonitis, classic cause of fibrinosuppurative pericarditis in cattle. Blood and lymphatic vascular systems. Core concept: vascular injury responses depend on endothelial cells and smooth muscle cells, which are metabolically active and central to inflammation, thrombosis, and vascular remodeling. endothelial cells, high-yield functions. Maintain antithrombotic surface, prostacyclin, NO. Regulate vascular tone. Control fluid distribution. Mediate angiogenesis. Recruit inflammatory cells. Transport macromolecules. Produce cytokines and growth factors. Injury sequence. Endothelial damage. Separation from basement membrane. Permeability, plasma proteins leak. Exposure of collagen thrombosis. Endothelial proliferation, re-endothelialization. Exam trap. Endothelial injury is the initiating event in DIC, vasculitis, hypertension, and atherosclerosis, in species where it occurs. Smooth muscle cells, high-yield functions. Produce collagen, elastin, proteolycans. Maintain vascular tone. Recruit monocytes. Metabolize lipoproteins. Produce prostaglandins and free radicals. Respond to cytokines and growth factors. Exam tip. Smooth muscle proliferation is central to vascular remodeling in hypertension and arteritis. Other high-yield notes. Regional differences in arterial intima uptake of macromolecules, lesion-prone areas, branch points, curves. In jaundiced animals, bilirubin binds elastin in large elastic arteries and endocardium. Produces yellow discoloration of the intima. A benign, post-hepatic indicator, not a primary vascular lesion. How to use this in Phase 2 answers. When you see vascular lesions, anchor your explanation to endothelial injury, mechanism plus consequences. Permeability changes. Thrombosis versus hemorrhage. Inflammation, acute versus chronic. Repair remodeling, SMC involvement. Medium White Star Extra ACVP Phase 2 exam tips for this section. Endocardial hemorrhage is often agonal, don't overinterpret. Mineralization of endocardium equals think vitamin D, calcinogenic plants, or metabolic imbalance. Congenital valve dysplasia, predictable hypertrophy patterns, pressure versus volume. Endothelial injury is the first step in thrombosis, always mention it. Smooth muscle cells are active participants, not passive structural elements. Pericardial lesions often reflect systemic disease, e.g., edema, cachexia, trauma. Elastic arteries mineralize readily due to elastic fiber content. Always distinguish vegetative endocarditis from jet lesions by location and cause. Disturbances of circulation. Hemorrhage. Core concept. Clarified cardiac hemorrhage is common, often nonspecific, and varies widely in severity. It can occur in the epicardium, endocardium, or myocardium. Types. Petechiae, 1 to 2 mm. Ecchymoses, 2 to 10 mm. Suffusive, diffuse sheets of hemorrhage. Common causes. Septicemia. Endotoxemia. Anoxia. Electrocution. Trauma. Agonal changes, especially in horses. Species note. Horses frequently show agonal epicardial and endocardial hemorrhages regardless of cause of death, a classic exam trap. Mulberry heart disease, vitamin E, selenium deficiency in pigs. Core concept, a peracute nutritional myopathy in rapidly growing pigs. Lesions. Severe myocardial hemorrhage. Hydropericardium. Red, mottled, mulberry-like, heart. Often fatal. Mechanism, oxidative damage, vascular necrosis hemorrhage. Exam tip, if you see hydropericardium plus myocardial hemorrhage in a pig, think mulberry heart disease. Effusions. Covered in detail elsewhere, but high-yield reminders. Hydropericardium, CHF, hypoproteinemia. Hemopericardium, trauma, neoplasia, RA hemangiosarcoma, aortic rupture. Chylopericardium, rare, lymphatic obstruction. Suppurative pericarditis, hardware disease in cattle. Exam trap, rapid accumulation cardiac tamponade, especially affecting RA and RV. Disturbances of growth. Full details in later sections, but here's the high-yield anchor. Hypertrophy of arteries. Core concept: arterial hypertrophy equals thickening of tunica media due to smooth muscle hypertrophy and mild hyperplasia. Occurs in muscular arteries, especially pulmonary arteries. Mechanisms: pressure overload, volume overload, hypoxia-induced vasoconstriction, pulmonary arterial hypertrophy in cats. Causes: Eleurostrongylos abstrusus, lungworm, Toxocara spp, Dirofilaria immitis, heartworm, idiopathic, common. Clinical signs: often none, sometimes asthma-like signs. Exam tip: pulmonary arterial hypertrophy in cats does not always indicate heartworm, many cases are idiopathic. High-altitude disease, brisket disease, in cattle. Mechanism: hypoxia, pulmonary vasoconstriction, pulmonary hypertension. RV pressure overload, concentric RV hypertrophy. Right-sided CHF. Lesions: hypertrophy of muscular pulmonary arteries, RV dilation and hypertrophy. Ventral edema, brisket edema. Exam tip: this is a classic example of secondary pulmonary hypertension. Left to right shunts, pulmonary hypertension. Mechanism: PDA, VSD, ASD, pulmonary blood flow. Chronic high-flow medial hypertrophy of pulmonary arteries. Severe cases: plexogenic pulmonary arteriopathy. Exam trap: plexogenic arteriopathy equals severe, irreversible pulmonary hypertension. Physiologic hypertrophy. Uterine arteries in pregnant animals. Reversible after parturition. Blood and lymphatic vascular systems. Core concept: vascular injury responses depend on endothelial cells and smooth muscle cells, which are metabolically active and central to inflammation, thrombosis, and vascular remodeling. Endothelial cells, high-yield functions: maintain thromboresistant surface, produce prostacyclin, NO, regulate vascular tone, control fluid distribution, recruit inflammatory cells, mediate angiogenesis, transport macromolecules. Injury sequence: endothelial separation from basement membrane, permeability, plasma protein leakage, exposure of collagen, thrombosis, endothelial proliferation repair. Exam tip: endothelial injury is the first step in thrombosis, vasculitis, and DIC. Smooth muscle cells, high-yield functions: produce collagen, elastin, proteolycans, maintain vascular tone, recruit monocytes, metabolize lipoproteins, produce prostaglandins and free radicals, respond to cytokines and growth factors. Exam trap: smooth muscle proliferation is central to vascular remodeling in hypertension and arteritis. Medium white star extra ACVP phase 2 exam tips for this section. Horses commonly have agonal cardiac hemorrhage, don't overinterpret. Mulberry heart disease equals hydropericardium plus myocardial hemorrhage in pigs. Pulmonary arterial hypertrophy in cats is often incidental. High-altitude disease equals hypoxia, pulmonary hypertension, RV hypertrophy. Left to right shunts, pulmonary hypertension, plexogenic arteriopathy. Endothelial injury is the initiating event in thrombosis, always mention it. Smooth muscle cells are active responders, not passive structural elements. Arterial hypertrophy equals tunica media thickening due to smooth muscle hypertrophy. Inflammation. General inflammatory mechanisms are covered in chapters 3 and 5, but here's the high-yield cardiovascular specific content. Arteritis and vasculitis. Core concept: clarified arteritis equals inflammation of arteries. Vasculitis angiitis equals inflammation of any vessel, arteries, veins, lymphatics. Most cases in animals are hematogenous, infectious, or immune-mediated. Morphologic hallmarks of vasculitis, exam critical. Leukocytes within and around vessel walls. Endothelial necrosis. Smooth muscle necrosis. Fibrinoid necrosis, bright eosinophilic, smudgy wall. Thrombosis. Ischemia or infarction in downstream tissues. Exam tip: fibrinoid necrosis equals immune-mediated or infectious vasculitis until proven otherwise. Causes of arteritis vasculitis. 1. Infectious agents. Bacteria, Salmonella, E. coli, Streptococcus, Bacillus anthracis. Viruses, classical swine fever, African horse sickness, African swine fever. Parasites, Strongylus vulgaris, horses, Dirofilaria emitis, dogs. Fungi, Histoplasma, Aspergillus. 2. Immune-mediated mechanisms. Type 3 hypersensitivity, immune complex deposition. Autoimmune vasculitis. Drug reactions. 3. Extension from adjacent inflammation. Metritis uterine vein phlebitis. Hepatic abscess vena cava thrombophlebitis. Exam trap: vasculitis is often secondary to systemic disease, don't assume it's primary. Septicemia associated vasculitis. Species relevant examples: pigs, salmonellosis, colobacillosis, severe gastric fundic congestion and hemorrhage. Cats, FIP pyogranulomatous phlebitis. Cattle, Bacillus anthracis, widespread hemorrhage and edema. Mechanism: endothelial injury, thrombosis, ischemia, hemorrhage. Iatrogenic vasculitis. Irritant 4 injections. Perivascular injections. Indwelling catheters, endothelial injury, phlebitis, thrombosis, septic emboli. Exam tip: septic emboli from phlebitis can cause endocarditis, pulmonary abscesses, or pulmonary infarcts. Thrombosis and embolism. Coronary arteries. Core concept: true myocardial infarction is rare in animals compared to humans. Causes include atherosclerosis, dogs with hypothyroidism or diabetes. Arteriosclerosis, aged dogs. Periarteritis. Thromboembolism. Exam tip: dogs with severe hypothyroidism or diabetes can develop coronary atherosclerosis, but infarction is still uncommon. Intramural arteriosclerosis in aged dogs. Thickened intramural arteries. Luminal narrowing. Small multifocal myocardial infarcts. Exam trap: these infarcts are often incidental and not the cause of death. Thrombosis in other arteries. Interlobular renal artery, renal infarct. Splenic artery, splenic infarct. Pulmonary artery, pulmonary infarct, rare in animals. Lymphangitis. Core concept: inflammation of lymphatic vessels. Lymphatics respond to injury just like blood vessels. Types: acute, subacute, chronic, granulomatous. Consequences: lymphedema, lymphangiectasia, protein losing enteropathy in dogs. Acute lymphangitis. Mechanism: skin penetration by pathogen, trauma, insect vectors. Red streaks along lymphatics. Draining lymph node inflammation, lymphadenitis. Exam tip: acute lymphangitis often progresses to chronic nodular lymphangitis. Chronic nodular lymphangitis. Core concept: nodular, ulcerative lesions along lymphatic channels. Causes include Corynebacterium pseudotuberculosis biovar equi, horses. Ulcerative lymphangitis. External abscesses. Internal abscesses. C. Pseudotuberculosis biovar ovis, sheep, goats. Caseous lymphadenitis. Histoplasma capsulatum var. Farciminosum. Epizootic lymphangitis, cutaneous, respiratory, ocular forms. Brugia pahangi, filarial nematode. Cats, dogs, humans. PCV2 in pigs. Mesenteric granulomatous lymphangitis, intestinal edema. Chlamydia sways in piglets. Idiopathic lymphangiectasia in dogs. Protein losing enteropathy. John's disease, MAP, in ruminants. Chronic granulomatous lymphangitis of small intestine. Exam trap, granulomatous lymphangitis in the intestine, think John's disease, PCV2, idiopathic lymphangiectasia, or chlamydia sways depending on species. Comparative note, Crohn's disease. Human Crohn's disease shows similar lymphangitic lesions, suggesting lymphatic obstruction may be a shared early pathogenic event. Medium White Star Extra ACVP Phase 2 exam tips for this section. Fibrinoid necrosis equals hallmark of vasculitis, always mention it. Horses commonly have agonal cardiac hemorrhage, don't overinterpret. Mulberry heart disease equals myocardial hemorrhage plus hydropericardium in pigs. Coronary infarction is rare in animals, if present, think atherosclerosis in dogs. FIP causes phlebitis, not arteritis, a favorite exam trick. Lymphangitis versus lymphadenitis. One is vessel inflammation, the other is node inflammation. Chronic lymphangitis in horses, think C. Pseudotuberculosis biovar equi. Granulomatous intestinal lymphangitis species specific differentials. John's, PCV2, lymphangiectasia. Vasculitis often leads to thrombosis, ischemia, infarction. Describe the sequence. Aging of the cardiovascular system. Core concept, clarified aging produces predictable, species-specific changes in the heart, vessels, and lymphatics. Most are degenerative, not inflammatory. Key aging changes, high yield. 1. Lipofuscin accumulation, brown atrophy. Perinuclear granules increase with age. Reflect oxidative stress and wear and tear. Most prominent in older dogs, cats, cattle. Exam tip, lipofuscin is not pathologic, don't misinterpret it as necrosis. 2. Fatty infiltration. Increased adipose tissue in pericardium and myocardium. Especially abundant in aged sheep, particularly RV. Not the same as fatty degeneration. 3. Myxomatous valvular degeneration, endocardiosis. Extremely common in older small breed dogs. Age-related degeneration of AV valves. Leads to regurgitation eccentric hypertrophy CHF. 4. Degenerative vascular disease. Arteriosclerosis, intimal fibrosis, medial thickening. Amyloidosis, especially in aged cats, cattle. Hyaline degeneration of cardiac arteries, aged dogs. Exam trap, arteriosclerosis not equal to atherosclerosis. Atherosclerosis is rare in animals except dogs with hypothyroidism or diabetes. 5. Increased neoplasia incidence. Hemangiosarcoma, dogs. Lymphoma, cats, cattle. Chemodectomas, brachycephalic dogs. Portals of entry, pathways of spread. Core concept, pathogens and toxins can enter the cardiovascular and lymphatic systems through multiple routes, and once inside, the circulatory system distributes them widely. This section is extremely testable because it explains how myocarditis, endocarditis, vasculitis, and pericarditis develop. Major routes of entry, high yield. 1. Ingestion. GI pathogens penetrate mucosa, enter lymphatics, reach bloodstream. Example, Salmonella, MAP, Johns. 2. Inhalation. Respiratory pathogens, alveoli, pulmonary capillaries, bloodstream. Example, viral pneumonias, septic emboli. 3. Cutaneous penetration. Trauma, insect vectors. Example, Corynebacterium pseudotuberculosis, Histoplasma farciminosum. Iatrogenic. 4 injections. Catheters. Contaminated needles. Phlebitis, thrombosis, septic emboli. 5. Direct extension. Hardware disease in cattle reticulum diaphragm pericardium. Pleural or mediastinal infections pericardium. How acute inflammation facilitates entry. Acute inflammation increases pathogen access to vessels by hyperemia, more capillaries exposed. Increased permeability, easier entry into venules lymphatics. Leukocyte migration, endothelial injury, easier penetration. Fibrin deposition traps organisms but also allows some to enter lymphatics. Exam tip. Inflammation both protects and facilitates spread, a classic paradox. Myocardium, pathways of spread. Core concept. The myocardium is highly vascularized, extremely vulnerable to hematogenous spread. How pathogens reach myocardium. Coronary arteries. Rich capillary network, nearly 1 capillary per myocyte. Bacteria, viruses in blood can easily lodge here. Septic emboli from valvular endocarditis. Vegetations shed coronary arteries, focal myocarditis or infarction. Toxins. Direct endothelial injury. Diffusion into myocardium. Direct extension. From endocardium or pericardium. Exam trap. Papillary muscles and subendocardium are most vulnerable due to high metabolic demand and lowest perfusion. Endocardium and heart valves, pathways of spread. Core concept. Valves and endocardium are directly bathed in blood, so any circulating pathogen or toxin contacts them first. High yield points. Left atrial endocardium is especially susceptible to uremic toxins in dogs. Parasites, bacteria, viruses, and toxins can all adhere to or damage valves. Turbulent flow predisposes to endocardial jet lesions. Exam tip. Uremic endocardial mineralization in dogs is a classic lesion. Epicardium and pericardium, pathways of spread. Routes of entry. Hematogenous spread. Direct penetration, trauma. Extension from pleura or mediastinum. Hardware disease in cattle, reticulum diaphragm pericardium. Exam trap. Hardware disease causes fibrinosuppurative pericarditis, not myocarditis. Blood and lymphatic vascular systems, pathways of spread. Core concept. These systems are designed to transport cells and molecules inherently vulnerable to pathogens. Mechanisms of entry. Hematogenous dissemination. Lymphogenous spread via draining lymph nodes. Parasitic migration, e.g., Strongylus vulgaris, Diarofilaria. Local extension from adjacent inflammation. Exam tip. Vasculitis often results from endothelial injury, not direct invasion. Defense mechanisms, barrier systems. Core concept. The cardiovascular and lymphatic systems rely heavily on innate and humoral immunity present within the blood and lymph. Key defenses. Constant flow prevents stasis and colonization. Plasma proteins, Ig, complement. Circulating leukocytes. Endothelial barrier. Coagulation system. Lymph nodes filtering lymph. Phagocytes in blood and tissues. Exam trap. Flow is a major defense. Stasis dramatically increases infection risk, e.g., thrombophlebitis. Medium white star extra ACVP phase 2 exam tips for this section. Aging changes are degenerative, not inflammatory, don't overinterpret. Lipofuscin equals normal aging, amyloid equals pathology. Myxomatous valve disease is the most common cardiac disease in dogs. Hardware disease, fibrinosuppurative pericarditis, not myocarditis. Coronary infarction is rare in animals, think atherosclerosis in hypothyroid diabetic dogs. Pathogens reach myocardium mainly via coronary circulation. Uremic toxins left atrial endocardial damage in dogs. Lymphangitis versus lymphadenitis. Vessel versus node, classic exam distinction. Flow is a major defense mechanism, mention it in essays. Acute inflammation paradox, increases both defense and pathogen entry. Diseases affecting multiple species of domestic animals. Core concept. This section introduces the major cardiac diseases that occur across species. The most important categories for Phase 2 are myocardial disorders, cardiomyopathies, valvular diseases, vascular diseases, pericardial diseases. Heritable cardiovascular diseases are also common exam material, e.g., feline HCM mutations. Disorders of the myocardium, hemorrhage, trauma, physical injury. Mechanism: blunt chest trauma, tearing of myocardium, hemorrhage. Neoplasms, especially hemangiosarcoma, invade myocardium, destroy vessel walls, hemorrhage. Exam tip: right atrial hemangiosarcoma in dogs is the classic cause of hemopericardium and sudden death. Cardiomyopathies. Core concept: cardiomyopathies equals primary myocardial diseases, intrinsic to the heart, or secondary, due to systemic disease. 5 morphologic types: hypertrophic, dilated, congestive, restrictive, orthethmogenic, right ventricular, unclassified. Exam trap: primary cardiomyopathies have no identifiable external cause. Secondary cardiomyopathies have a known cause: toxins, metabolic disease, endocrine disease, nutritional deficiency. Hypertrophic cardiomyopathy, HCM. This is one of the most testable diseases in veterinary pathology. HCM in cats, high yield. Most common primary myocardial disease in cats, almost equal to 60% of feline cardiomyopathy cases. Signalment: young adult to middle-aged male cats, 1 to 3 years. Strong breed predispositions. Autosomal dominant inheritance in Maine Coon, Ragdoll, American Shorthair. Other predisposed breeds: British Shorthair, Norwegian Forest, Turkish Van, Scottish Fold, Bengal, Siberian, Rex breeds. Genetic basis: sarcomeric protein defects. 2 known mutations in MYBPC3, cardiac myosin binding protein C, in Maine Coon and Ragdoll cats. Result in abnormal sarcomere function, myocyte hypertrophy, disarray, fibrosis. Exam tip: HCM equals sarcomeric disease. DCM equals cytoskeletal mitochondrial disease, in many species. Pathogenesis, mechanistic. Sarcomeric dysfunction, impaired relaxation. Myocyte hypertrophy, concentric LV thickening. Myocyte disarray, impaired contractility and conduction. Interstitial fibrosis, stiff ventricle. Diastolic dysfunction, LV filling pressure. Left atrial enlargement, blood stasis, thrombus formation. CHF and thromboembolism. Gross lesions. Concentric hypertrophy of LV, non-dilated, thick walls. Narrowed LV lumen. Heart weight body weight ratio, almost equal to 7 g kg vs normal, almost equal to 3.8 g kg. Mild RV enlargement sometimes present. Enlarged left atrium. Dynamic LV outflow tract obstruction, SAM. Systolic anterior motion, SAM, of the mitral valve occurs in a subset of cats. Mechanism: hypertrophied interventricular septum, anterior displacement of papillary muscles. Chordae tendineae pull mitral leaflet into LVOT. Creates a kissing lesion between septum and mitral leaflet. Causes dynamic obstruction during systole. Exam tip: SAM is diagnostic for this subset of HCM, mention it in essays. Clinical consequences. Diastolic heart failure, pulmonary edema, pleural effusion, sudden death, arrhythmias, aortic thromboembolism, saddle thrombus, in 10 to 20% of cases, posterior paresis, painful, cold hind limbs, poor prognosis, microscopic lesions, classic triad, very high yield, myocyte disarray, myocytes oriented perpendicular oblique, pinwheel or tangled patterns, myocyte hypertrophy, enlarged fibers, large, hyperchromatic nuclei, interstitial fibrosis, replacement fibrosis in areas of ischemia, coronary microvascular remodeling, small vessel disease, arteriosclerosis of intramural arteries, smooth muscle proliferation, intimal thickening, luminal narrowing ischemia fibrosis. Exam trap: small vessel disease contributes to myocardial infarction in HCM cats. HCM in dogs, much less common than in cats. Signalment: young males, less than 3 years. Reported in large breeds. Possible inherited basis in pointers. Lesions: symmetric LV hypertrophy, free wall plus septum. Dynamic LVOT obstruction common. Thickened mitral leaflet or abnormal papillary muscle position. Myocyte disarray reported in some cases. Coronary arterial changes similar to cats. Exam tip: in dogs, HCM may involve valvular malposition, not just myocardial disease. Medium white star extra ACVP phase 2 exam tips for this section. HCM equals diastolic failure, not systolic. Myocyte disarray is pathognomonic for HCM, always mention it. SAM plus kissing lesion equals classic for obstructive HCM in cats. Saddle thrombus arises from left atrial stasis. Small vessel disease contributes to ischemia and fibrosis. HCM in dogs is rare, don't overdiagnose. Concentric hypertrophy equals pressure overload OR HCM, differentiate by cause. Sudden death in HCM equals arrhythmia from disarray fibrosis. Genetic mutations in MYBPC3 are autosomal dominant. Dilatative, congestive, cardiomyopathy. Core concept: clarified DCM equals systolic failure due to impaired contractility, eccentric hypertrophy, and chamber dilation. It is a major cause of CHF in dogs, cats, and cattle. Signalment and breed predispositions: high yield. Dogs, most important species. Typically large breed males, including Doberman Pinscher, Boxer, Great Dane, Irish Wolfhound, Scottish Deerhound, Saint Bernard, Newfoundland, Afghan Hound, Old English Sheepdog, Portuguese Water Dog, Dalmatian. Smaller breeds can be affected. English Cocker Spaniel, Manchester Terrier. Inheritance patterns, exam critical. Portuguese Water Dog, autosomal recessive. Irish Wolfhound, Newfoundland, Doberman, autosomal dominant. Boxer, likely X-linked recessive, ties into ARVC genetics. Exam tip: Dobermans and Boxers are the poster children for DCM, always mention them. Gross pathology. Heart shape: rounded, globoid heart due to biventricular dilation. Sometimes left-sided dilation predominates. Chamber changes: markedly dilated ventricles and atria. Eccentric hypertrophy, thin walls plus large chambers. Increased annular circumference of mitral and tricuspid valves. Papillary muscles flattened and atrophic. Chordae tendineae elongated and thickened. Endocardium diffusely white and thickened, fibrosis. Heart weight: increased heart weight-body weight ratio. Hypertrophy equals increased cell size, not number. Exam trap: DCM equals eccentric hypertrophy, sarcomas added in series. HCM equals concentric hypertrophy, sarcomas added in parallel. Histologic patterns of DCM, very high yield. There are two distinct histologic forms in dogs. This is one of the most testable distinctions in the chapter. 1. Attenuated wavy fiber type. Seen in giant, large, and medium-sized dogs. Features: myocytes less than 6 micrometers in diameter, normal equals 10 to 20 micrometers. Wavy, attenuated fibers. Clear spaces between fibers, edema. Minimal to absent inflammation. Most prominent in lateral LV free wall, important sampling site. Diagnostic performance: sensitivity 98%. Specificity 100%. This is a very strong diagnostic marker for DCM in dogs. Exam tip: if you see attenuated wavy fibers, you can confidently diagnose DCM. 2. Fatty infiltration degenerative type. Seen in Boxers. Doberman pinschers. Features: myocytolysis. Myofiber degeneration and vacuolization. Atrophy. Extensive fibrosis. Fatty infiltration replacing myofibers. Interpretation: likely represents a different disease process than the attenuated wavy fiber type. Exam trap: this pattern overlaps with orthethmogenic right ventricular cardiomyopathy, ARVC, in Boxers, but ARVC is RV predominant. Additional histologic findings, nonspecific. Myocyte necrosis. Infarcts. Interstitial fibrosis. Myocyte vacuolization. Coronary artery hyperplasia. These findings support chronic myocardial injury but are not specific for DCM. Pathogenesis. Mechanistic summary. Genetic or acquired defect impaired contractility. Stroke volume CO. Compensatory eccentric hypertrophy. Progressive dilation, annular dilation, valvular insufficiency. CHF, left, right, or biventricular. Arrhythmias, syncope or sudden death. Exam tip: DCM equals systolic dysfunction. HCM equals diastolic dysfunction. Secondary, acquired, dilatative cardiomyopathy. These are specific heart muscle diseases with known causes. Toxic causes: doxorubicin, classic. Irradiation. Ethanol. Cobalt. Lead. Catecholamines. Histamine. Methylxanthines, e.g., theobromine. Infectious causes: canine parvovirus, myocarditis, chronic dilation. Nutritional causes: taurine deficiency, cats, some dogs. Carnitine deficiency, Boxers, Dobermans. Exam trap: taurine deficiency used to be the most common cause of DCM in cats before commercial diets were corrected. Medium White Star Extra ACVP Phase 2 Exam Tips for DCM. DCM equals eccentric hypertrophy. HCM equals concentric. Always state this. Attenuated wavy fibers are highly specific for DCM in dogs. Boxers plus Dobermans think fatty infiltration degenerative type. Doxorubicin cardiotoxicity produces dilated cardiomyopathy-like lesions. Taurine deficiency reversible DCM in cats, and some dogs. DCM is a systolic failure disease, mention this explicitly. Sudden death in DCM is often due to ventricular arrhythmias. Always sample the lateral LV free wall when DCM is suspected. Genetic inheritance patterns are frequently tested, especially Portuguese water dogs and Dobermans. Idiopathic dilatative cardiomyopathy, cats. Core concept: idiopathic DCM in cats is rare. Most feline DCM is secondary, not primary. Primary, idiopathic, feline DCM. Rare. Complex genetic inheritance suspected. Causes systolic heart failure, contrast with HCM diastolic failure. Secondary feline DCM, much more common. Causes include taurine deficiency, classic, now uncommon due to diet correction. Doxorubicin toxicity. Severe volume overload. Chronic mitral insufficiency. Congenital LR shunts. Feline panleukopenia virus, rare. Exam tip: if you see DCM in a cat, think taurine deficiency unless proven otherwise. Gross lesions. Global dilation of all chambers. Eccentric hypertrophy, thin walls plus large chambers. Heart weight-body weight ratio, almost equal to 5.4 g kg vs normal almost equal to 3.8 g kg. Hydrothorax, pulmonary congestion, pulmonary edema when CHF develops. Microscopic lesions. Interstitial edema. Interstitial fibrosis. Myocytes thin, attenuated, wavy. Myocytolysis. Exam trap: feline DCM can also produce arterial thromboembolism, similar to HCM unlike dogs, where ATE is rare in DCM. Bovine dilatative cardiomyopathy. 3 recognized forms, all heritable and all causing CHF plus dilation. 1. Dilatative cardiomyopathy in Canadian Holstein origin cattle. Reported in Holstein, Red Holstein Friesian, Red Danish. Autosomal recessive inheritance. CHF with cardiac dilation. Histology: loss of myocytes plus replacement fibrosis. 2. Japanese black cattle cardiomyopathy. Affects newborn and infant calves. Marked myocardial degeneration and necrosis. Suspected lethal autosomal recessive gene. 3. Congenital cardiomyopathy in Pole Hereford cattle. Occurs with woolly haircoat syndrome. Lethal autosomal recessive. Calves die of CHF by 12 weeks. Severe myocardial degeneration. Exam tip: all bovine cardiomyopathies are inherited, early onset, and fatal. Restrictive cardiomyopathy, RCM. Core concept: RCM equals diastolic failure due to stiff myocardium. It is a functional category, not a single disease. Hallmark: impaired ventricular filling due to fibrosis plus or minus inflammatory infiltrates. Forms of RCM in cats. 1. Endomyocardial fibrosis type. Diffuse LV endocardial fibrosis. Often preceded by endomyocarditis. Severe endocardial thickening, fibrosis plus granulation tissue. 2. Excessive moderator bands type. Abnormal fibrous bands traversing LV cavity. Mechanical obstruction to filling. Other species. Aged rats, endocardial fibrosis. Burmese cats, congenital endocardial fibroelastosis, classic. Exam trap, RCM equals normal systolic function, severe diastolic dysfunction. Arrhythmogenic right ventricular cardiomyopathy, ARVC. One of the most testable cardiomyopathies in dogs. Signalment. Middle-aged boxer dogs, classic. English bulldogs. Rare in cats. Genetics. Autosomal dominant in boxers. Associated with STRN, striatin, gene 8BP deletion. Abnormal WNT protein trafficking. Possible calstobin 2 deficiency. Exam tip, ARVC is a desmosomal disease similar to human ARVC. Clinical features. Ventricular arrhythmias. Left bundle branch block morphology. Arrhythmias originate from RV. RV enlargement in many cases. But some dogs have normal-sized chambers. Arrhythmias may be intermittent. Normal ECG does not rule it out. Histopathology. Fibrofatty replacement of RV myocardium. Fatty or fibrofatty pattern. Loss of cardiomyocytes. Arrhythmogenic substrate macrorentrant circuits. Cats with ARVC. Moderate to severe RV eccentric hypertrophy. Severe RA enlargement. Fibrofatty infiltration atrial plus ventricular arrhythmias. Unclassified cardiomyopathy. Core concept. A diagnosis of exclusion when features do not fit HCM, DCM, RCM, or ARVC. Features. Left or bilateral atrial dilation. Normal or near normal LV wall thickness. Normal systolic function. Diastolic dysfunction. No clear endomyocardial fibrosis, otherwise would be RCM. Diagnosis, often made antemortem via echocardiography showing restrictive filling pattern, ear wave changes. Molecular mechanisms of hereditary cardiomyopathies. High yield summary. HCM equals sarcomeric protein mutations. Beta-myosin heavy chain. Troponin T. Tropomyosin. MYBPC, myosin binding protein C. Mechanism, defective energy transfer from mitochondria to sarcomere hypertrophy plus disarray. DCM equals cytoskeletal membrane protein mutations. Desmin. Dystrophin. Titin. Mitochondrial proteins. Dystrophin-associated glycoproteins. Mechanism, abnormal force generation, force transmission, or myocyte signaling dilation plus systolic failure. Animals mirror human patterns. Similar mutations identified in feline HCM, MYBPC3, canine DCM, dystrophin, titin variants. Boxer ARVC, STRN. Medium white star extra ACVP phase 2 exam tips for this section. Feline DCM is usually secondary, taurine deficiency is the classic cause. Attenuated wavy fibers equals DCM in dogs, very high specificity. ARVC equals fibrofatty replacement of RV, always mention STRN mutation. RCM equals diastolic failure, normal systolic function, fibrosis is the key. Endocardial fibroelastosis equals Burmese kittens. Bovine cardiomyopathies are heritable, early onset, and fatal. HCM equals sarcomeric mutations, DCM equals cytoskeletal mutations, this distinction is testable. ARVC arrhythmias may be intermittent. Normal ECG does not exclude disease. Cats with DCM can develop ATE, unlike dogs. Unclassified cardiomyopathy is a diagnosis of exclusion. Neoplasms. Core concept. The heart can develop primary tumors, rare, and secondary metastatic tumors, common. The location and species patterns are highly testable. Primary cardiac tumors. 1. Rhabdomyoma, rhabdomyosarcoma. Rare in domestic animals. White, gray nodules in myocardium. May protrude into chambers. Rhabdomyomatosis in pigs, guinea pigs equals hamartoma, not true neoplasm. Large glycogen-laden cells resembling cardiomyocytes Purkinje cells. Also reported in cattle, sheep, dogs. Exam tip: rhabdomyomas in pigs equals congenital hamartomas, not malignant tumors. 2. Schwannoma. Rare. Arises from cardiac nerves. 3. Hemangiosarcoma, HSA. Most important primary malignant cardiac tumor in dogs. Classic location, right atrium. Causes hemopericardium, cardiac tamponade, sudden death. Exam trap: right atrial HSA is the most common cause of hemopericardium in dogs. Secondary, metastatic, tumors. Malignant lymphoma, most common secondary tumor. Especially common in cattle. Can be severe enough to cause CHF. Also occurs in dogs and cats. Gross, white nodules or diffuse infiltrates resembling fat. Micro, sheets of neoplastic lymphocytes between myocytes. Exam tip: cardiac lymphoma in cattle is often part of enzootic bovine leukosis, BLV associated. Other metastatic tumors. Malignant melanoma. Carcinomas. Sarcomas. Heart-based tumors, paragangliomas, chemodectomas. Core concept: primary tumors of extracardiac tissues at the base of the heart. Aortic body tumor, chemodectoma. Most common heart-based tumor. Arises from aortic body chemoreceptors. Large, white, firm masses compressing great vessels and atria. Brachycephalic dogs predisposed. Chronic hypoxia suspected. Exam trap: chemodectomas are not myocardial tumors, they arise from paraganglia. Myocardial necrosis and mineralization. Core concept: many toxins and metabolic disorders cause multifocal myocardial necrosis, often with mineralization. Gross lesions look similar regardless of cause. Gross lesions, high yield pattern. Pale white tan streaks. Linear or patchy. Flabby myocardium. May mineralize, gritty. Microscopic lesions. Vacuolation. Loss of cross striations. Hyperiocinephilia. Fragmentation. Coagulation necrosis. Nuclear pycnosis karyolysis. Exam tip: subendocardial and papillary muscle necrosis equals classic for ischemia or toxic injury. Major causes of myocardial necrosis, high yield. 1. Ionophore toxicity. Toxins, monensin, lacillocid, salinomycin, narazine species sensitivity. Horses, extremely sensitive. Dogs also sensitive. Ruminants tolerate higher doses. Mechanism: ionophores transport Na and Ca² across membranes. Intracellular Ca² mitochondrial swelling ATP. Lipid peroxidation, membrane damage. Oncotic necrosis. Sources of exposure: contaminated horse feed. Feed mill cross-contamination. Ruminant feed mistakenly fed to horses. Exam trap: ionophore toxicity equals acute myocardial necrosis with massive Ca² overload. 2. Gossipal toxicity. Source: cottonseed products toxic only in free, unbound form. Species sensitivity: monogastrics, pigs, horses, equals most sensitive. Ruminants more resistant, binding in rumen. Mechanism: direct myocardial degeneration and necrosis. Conduction failure. Lesions: pale, flabby myocardium. Multifocal necrosis, similar to ionophores. Exam tip: gossipal lesions are indistinguishable from ionophore lesions, rely on history.
3.
Vitamin E, selenium deficiency. Young animals of all species. White muscle disease. Myocardial and skeletal muscle necrosis. Mineralization common.
4.
Anthracycline, doxorubicin, toxicity. Dogs receiving chemotherapy. Causes hydropic degeneration, mitochondrial swelling, vacuolization. Chronic exposure DCM-like dilation.
5.
Gossipal, white snakeroot, plant toxins. Acacia georgini. Dicopetalum cymosum. Many cause myocardial necrosis plus conduction abnormalities.
6.
Heart-brain syndrome, neurogenic myocardial necrosis. Dogs with severe CNS trauma. Catecholamine surge contraction band necrosis. Classic lesion, subendocardial necrosis. Sarcocystis, parasitic infection. Core concept: sarcocystis SPP. Form intracellular cysts in cardiac muscle and Purkinje fibers. Species: horses. Cattle. Sheep, goats. Pigs. Occasionally cats. Pathogenesis: carnivore sheds oocysts. Intermediate host ingests. Sporozoates penetrate intestine bloodstream muscle. Form cysts in myocytes. Clinical significance: usually incidental. No inflammation unless cysts rupture. Exam trap: sarcocystis cysts equals incidental unless ruptured, then granulomatous inflammation. Medium white star extra ACVP phase 2 exam tips for this section. Right atrial hemangiosarcoma equals most common cause of hemopericardium in dogs. Chemodectomas occur at the heart base, especially in brachycephalic dogs. Lymphoma is the most common secondary cardiac tumor, especially in cattle. Ionophore toxicity equals Ca squared overload acute necrosis. Horses are extremely sensitive. Gossipal toxicity mimics ionophore toxicity, rely on feed history. Vitamin E, selenium deficiency, white muscle disease with mineralization. Anthracyclines cause hydropic degeneration and chronic DCM-like changes. Sarcocystis cysts are incidental unless ruptured. Contraction band necrosis equals heart-brain syndrome, catecholamine surge. Many toxins produce identical myocardial necrosis patterns. History is essential. Disorders of the cardiac conduction system. Core concept: conduction system disease in animals is usually secondary to myocardial injury, inflammation, fibrosis, neoplasia. Primary inherited conduction disorders are breed-specific and highly testable. Cell degeneration and death in the conduction system. Secondary conduction disorders caused by myocarditis, myocardial fibrosis, neoplasia, degeneration adjacent to SAN, AVN, bundle branches. These lesions disrupt impulse generation or propagation arrhythmias. Inherited breed-specific conduction disorders, high yield. Pug dogs, bundle of his lesions. Syncope. Conduction block. Dalmatians, intermittent sinus arrest. Associated with congenital deafness. SAN dysfunction. Miniature schnauzers, Westies, Cocker Spaniels, Dachshunds, sick sinus syndrome. Sinoatrial syncope. SAN dysfunction, bradyarrhythmias. German Shepherds, inherited ventricular arrhythmia. Sudden unexpected death. No gross lesions. Alaskan sled dogs, widespread conduction lesions. Sudden death during racing. Multifocal fibrosis and degeneration. Exam tip: sudden death plus conduction lesions equals think German shepherds or sled dogs. Common arrhythmias in dogs and horses. Atrial fibrillation. Dogs, usually secondary to atrial dilation from CHF. Horses, often incidental, many live normal lives. May respond to cardioversion. Necropsy, atrial myocardial fibrosis. Heart block. First degree, delayed AV conduction. Second degree, intermittent dropped beats. Normal in horses, physiologic vagal tone. Third degree, complete block. Associated with myocardial scarring in dogs' horses. Persistent atrial standstill. English Springer Spaniels, cats. Marked atrial dilation plus fibrosis. Silent atria. Cattle. Atrial fibrillation associated with RA dilation and fibrosis. Sudden death in racehorses with RA fibrosis plus septal fibrosis plus intramyocardial arteriosclerosis. Schwannomas. Occur in cardiac nerves of cattle. Incidental findings at slaughter. White nodules. Not clinically significant. Disorders of the endocardium and heart valves. This section transitions into congenital anomalies, which are extremely testable. Developmental errors, congenital anomalies. Core concept: congenital cardiovascular anomalies arise from errors in embryologic development of the heart and great vessels. Severity ranges from lethal in utero resorption, severe defects neonatal death, moderate defects clinical disease, mild defects incidental findings. Ectopia cordis. Heart located outside thoracic cavity. Rare. Reported in cattle, subcutaneous in caudoventral neck. Causes of congenital cardiovascular anomalies. Heritable, especially in dogs. Teratogens, thalidomide, ethanol, salicylates, griseofulvin, cortisone. Radiation. Fetal hypoxia. Nutritional deficiencies, vitamin A, pantothenic acid, riboflavin, zinc. Nutritional excess, vitamin A, retinoic acid, copper. Suspected infectious causes, blue tongue, sheep, BVDV, cattle, parvovirus, dogs, cats. Classification of congenital cardiac malformations, high yield. 4 major categories. 1. Defects causing volume overload. Left to right shunts. Patent ductus arteriosus, PDA. Ventricular septal defect, VSD. Atrial septal defect, ASD. Endocardial cushion defects. Mechanism: left-right shunt pulmonary blood flow, venous return, eccentric LV hypertrophy. Valvular regurgitation. Mitral dysplasia. Tricuspid dysplasia. Aortic insufficiency. Pulmonic insufficiency. Mechanism: regurgitation, atrial dilation, eccentric ventricular dilation.
2.
Defects causing pressure overload. Pulmonic stenosis. Aortic stenosis, subaortic stenosis in dogs. Coarctation of the aorta. Interrupted aortic arch. Mechanism: outflow obstruction, ventricular pressure, concentric hypertrophy, diastolic failure. Exam trap: subaortic stenosis is extremely common in large breed dogs, Newfoundlands, Boxers, Goldens.
3.
Cyanosis. Defects causing cyanosis, right to left shunts. Tetralogy of Fallot, TOF. Right to left PDA. Right to left VSD. Tricuspid atresia RV hyperplasia. Double outlet RV. Transposition of great vessels. Truncus arteriosus. Aorticopulmonary window. Mechanism: deoxygenated blood enters systemic circulation cyanosis. Exam tip: TOF equals VSD plus pulmonic stenosis plus overriding aorta plus RV hypertrophy.
4.
Miscellaneous defects. Peritoneo-pericardial diaphragmatic hernia, PPDH. Persistent right aortic arch, PRAA. Endocardial fibroelastosis. Anomalous pulmonary venous return. Double aortic arch. Retroesophageal left subclavian artery. Valvular hematomas. Situs inversus. Exam trap: PRAA esophageal constriction megasophus in puppies. Medium white star extra ACVP phase 2 exam tips for this section. Second degree AV block is normal in horses, don't overinterpret. Persistent atrial standstill equals Springer Spaniels plus atrial fibrosis. PDA, VSD, ASD eccentric hypertrophy, volume overload. Aortic pulmonic stenosis concentric hypertrophy, pressure overload. TOF is the most common cyanotic congenital defect in animals. PRAA causes megasophus, not primary esophageal disease. Subaortic stenosis is extremely common in large breed dogs. Right to left shunts polycythemia, compensatory. Ectopia cordis is rare but memorable heart in neck of cattle. Congenital anomalies often cluster in certain breeds, always mention breed predispositions. Failure of closure of fetal cardiovascular shunts and major congenital defects. Tetralogy of Fallot, TOF. Core concept: TOF equals 4 lesions, but only 3 are primary. The fourth is secondary. Primary defects: high VSD, membranous septum. Pulmonic stenosis. Dextroposition, overriding, of the aorta. Secondary defect: right ventricular hypertrophy. Develops due to pressure overload from pulmonic stenosis. Pathophysiology: high yield. Pulmonic stenosis RV pressure. Blood shunts right-left across VSD. Deoxygenated blood enters systemic circulation. Hypoxemia, cyanosis, secondary polycythemia. Exam trap: TOF is the most common cyanotic congenital heart defect in animals. Species and genetics. Occurs in all species. Inherited in case haunts, autosomal locus, partial penetrance in heterozygotes. Common in English bulldogs. Mechanistic defect: hyperplasia plus malposition of the conotruncal septum. Interventricular septal defect, VSD. Core concept: failure of complete formation of the interventricular septum left to right shunt, initially. Locations: testable. High membranous septum, most common. Below aortic valve. Near septal tricuspid leaflet. Below pulmonic valve. Breed predispositions: English Bulldog, English Springer Spaniel, West Highland White Terrier. Pathophysiology: left-right shunt, systemic pulmonary. Volume overload of pulmonary circulation. Increased venous return to LV. Eccentric LV hypertrophy. Exam tip: large VSDs may reverse, Eisenmenger physiology, right to left shunt cyanosis. Atrial septal defect, ASD. 2 mechanisms. Patent foramen ovale, failure of postnatal closure. True septal defect, maldevelopment of septum primum secundum. Breed predispositions: boxer, Doberman pinscher, Samoyed. Pathophysiology: left-right shunt. RA and RV volume overload. Pulmonary overcirculation. eccentric hypertrophy of right heart, failure of normal valvular development, pulmonic stenosis, one of the most common congenital defects in dogs. Types: subvalvular, fibrous muscular ring, valvular, dome-shaped thickened valve with small central orifice, supravalvular, rare, breed predispositions, beagle, inherited, boxer, English bulldog, basset hound, chihuahua, chow chow, cocker spaniel, Labrador, Newfoundland, Samoyed, Schnauzer, terriers, special form, English bulldogs and boxers, anomalous coronary artery compresses RVOT functional stenosis. Pathophysiology: RV outflow obstruction, concentric RV hypertrophy, diastolic dysfunction, aortic and subaortic stenosis, SAS. Core concept: true valvular aortic stenosis is rare, subaortic stenosis is common. Species and breeds: dogs, large breeds, pigs, Newfoundlands, autosomal dominant, boxers, bull terriers, Goldens, Rottweilers, German short-haired pointers, Great Danes, Samoyeds, lesion, fibrous ridge or ring below aortic valve, may extend into mitral leaflet or aortic valve base. Mild cases: white nodules below valve, microscopic features, loose elastic fibers, mucopolysaccharide ground substance, collagen, fibroblasts plus chondrocyte-like cells, secondary lesions, concentric LV hypertrophy, myocardial necrosis, subendocardial fibrosis, arterial wall thickening. Exam trap: SAS is the most common congenital cardiac defect in large breed dogs. Valvular dysplasias, endocardial cushion defects. Core concept: maldevelopment of AV valves or endocardial cushions, regurgitation or stenosis. Endocardial cushion defects. Persistent AV canal. AV canal defect. Common in pigs, sheep, cats. Most common congenital cardiac anomaly in cats. Tricuspid valve dysplasia, TVD. Genetics: Labrador retrievers, autosomal dominant, reduced penetrance, chromosome 9. Morphologic abnormalities: thickened, rolled, notched leaflets, incomplete separation from ventricular wall, abnormal chordae, short, long, fused, thickened, direct insertion into papillary muscle atrophy or malposition. Pathophysiology: regurgitation, RA dilation, RV eccentric hypertrophy, stenosis, RA pressure, systemic venous congestion, mitral valve dysplasia, MIVD, often occurs with ASD, VSD, TVD. Morphologic abnormalities: same spectrum as TVD. Pathophysiology: insufficiency, LA dilation, LV eccentric hypertrophy, stenosis, impaired filling, low CO, pulmonary edema, RV dilation, secondary pulmonary hypertension, endocardial fibroelastosis. Classic species: Burmese cats, Siamese cats, historically. Lesion: marked thickening of LV endocardium, proliferation of fibroelastic tissue, smooth muscle hyperplasia plus fibroplasia in inner endocardial layers. Mechanism: developmental reaction to decreased myocardial motility, in utero or neonatal. Exam trap: endocardial fibroelastosis is a subtype of restrictive cardiomyopathy. valvular hematomas, hematocysts. Common in newborn ruminants. Blood-filled cysts on AV valves. Usually regress. No functional significance. Valvular lymphocysts. Yellow, serum-filled cysts on AV valves. Incidental. Ulcerative endocarditis, uremic endocarditis. Classic in dogs with acute or repeated uremia. Lesion. Ulceration of left atrial endocardium. Healing fibrosis plus or minus mineralization. Chronic LA dilation. Exam tip: uremic endocarditis is not infectious, it is a metabolic injury. Myxomatous valvular degeneration, endocardiosis. Most common valvular disease in older small breed dogs. Covered in detail elsewhere. Leads to mitral regurgitation, eccentric hypertrophy CHF. Endocardial mineralization. Causes: excess vitamin D. Calcinogenic plants, Cestrum diurnum, Solanum spp, Tricetum flavescens. Chronic dilation. John's disease, cattle. Healed uremic endocarditis. Jet lesions, turbulent blood trauma. Lesions. Large, white, rough plaques of mineralized fibroelastic tissue. Affects endocardium plus large elastic arteries. Endocardial fibrosis. Occurs in chronically dilated hearts. John's disease. Healed uremic endocarditis. Jet lesions. Exam trap: mineralization and fibrosis often coexist, but fibrosis alone can occur in chronic dilation. Medium White Star Extra ACVP Phase 2 exam tips for this section. TOF equals VSD plus pulmonic stenosis plus overriding aorta plus RV hypertrophy, always list all four. TOF is the most common cyanotic congenital defect. VSDs are usually high membranous and cause eccentric LV hypertrophy. ASD equals patent foramen ovale vs true septal defect, both testable. Pulmonic stenosis concentric RV hypertrophy. SAS is the most common congenital defect in large breed dogs. Endocardial cushion defects equals most common congenital defect in cats. PRAA megasophus, testable association. Uremic endocarditis affects left atrium, metabolic, not infectious. Valvular hematocysts in calves are incidental. Endocardial fibroelastosis equals Burmese cats plus restrictive physiology. Jet lesions cause focal endocardial mineralization. Vegetative valvular and mural endocarditis. Core concept: endocarditis equals bacterial infection of valves, almost always, producing friable fibrin ear bacterial vegetations. It is a thromboinflammatory lesion driven by Virchow's triad. Etiology. Most common cause: bacteria, overwhelming majority. Less common causes: Strangulus vulgaris larvae, horses, mural endarteritis, mural endocarditis. Fungi, rare, usually immunosuppressed or catheter associated. Gross lesions, high yield pattern recognition. Large, friable, yellow-gray, adherent vegetations. Located on valves, valvular endocarditis. May extend onto adjacent wall, mural endocarditis. Can occlude valve orifice. Chronic lesions verrucae, wart-like fibrous nodules. Exam trap: vegetations are friable, they break off septic emboli. Microscopic lesions. Thick layers of fibrin. Numerous bacterial colonies. Underlying neutrophils, macrophages. Granulation tissue in chronic lesions. Fibrosis in organizing vegetations. Valve predilection, very testable. Relative frequency in animals. Mitral aortic tricuspid pulmonic. Species nuance. Cattle, tricuspid involvement more common, ruminitis liver abscess vena cava tricuspid. Dogs, mitral and aortic dominate. Horses, aortic most common. Pathogenesis, Virchow's triad. Endocarditis requires all three. Endothelial injury. Turbulence, PDA, VSD, SAS. Catheters. Jet lesions. Trauma. Turbulent blood flow. Congenital defects. Valvular dysplasia. Regurgitant jets. Hypercoagulability. Systemic inflammation. Sepsis. Neoplasia. Typical initiating scenario. Pre-existing infection, mastitis, pneumonia, dermatitis, hepatic abscess, bacteremia. Bacteria adhere to damaged valve. Fibrin deposition vegetations. Progressive enlargement valve dysfunction. Clinical consequences.
1.
Valvular insufficiency CHF. Mitral left-sided CHF. Aortic left-sided CHF. Tricuspid right-sided CHF.
2.
Septic emboli. Vegetations break off lodge in. Kidneys infarcts. Synovium septic arthritis. Lungs, right-sided lesions, pulmonary abscesses. Myocardium septic infarcts. CNS meningitis, abscesses. Bone osteomyelitis.
3.
Death. CHF. Sepsis. Embolic complications. Species-specific associations, exam gold. Cattle. Liver abscesses, Fusobacterium necrophorum, septic emboli tricuspid endocarditis. Most common species for right-sided lesions. Pigs. Erysipelathrix rhusiopathiae vegetative endocarditis. Horses. Streptococcus spp. Aortic valve most commonly affected. Dogs. Staphylococcus, Streptococcus, Bartonella. Mitral and aortic valves. Atrial thrombosis. Core concept: atrial thrombi form due to stasis, turbulence, and endothelial injury, the same Virchow's triad. Predisposing factors: atrial dilation, DCM, HCM, valvular insufficiency. Endocardial injury. Hypercoagulability. Turbulent flow. Consequences: thromboembolism, e.g., feline saddle thrombus. Atrial dysfunction. Sudden death, rare. Exam tip: atrial thrombosis is common in cats with HCM due to LA enlargement plus stasis. Medium White Star Extra ACVP Phase 2 exam tips for this section. Vegetative endocarditis equals bacterial plus fibrin plus friable vegetations, always mention all three. Mitral valve is most commonly affected in dogs, tricuspid in cattle, aortic in horses. Strangulus vulgaris causes mural endocarditis, not classic valvular vegetations. Chronic vegetations become verrucey, fibrous, wart-like. Septic emboli infarcts in kidney, myocardium, bone, synovium list at least 2 in essays. Virchow's triad is always the pathogenesis, endothelial injury plus turbulence plus hypercoagulability. Atrial thrombosis in cats equals think HCM and LA enlargement. Right-sided endocarditis pulmonary emboli, left-sided systemic emboli. Endocarditis is not the same as endocardiosis, don't mix them. Disorders of the pericardium and epicardium. Developmental errors, congenital anomalies. Peritoneo-pericardial diaphragmatic hernias, PPDH. Core concept: PPDH equals congenital failure of separation between peritoneal and pericardial cavities. Abdominal organs herniate into pericardial sac. Key features. Most common congenital pericardial anomaly in cats. Overrepresented, Persians, domestic longhairs. Caused by defective separation of liver plus septum transversum during embryogenesis. Herniated organs, liver, most common, omentum, intestines, fat. Herniated liver may develop intrahepatic myelolipomas, classic association. Pathophysiology. Compression of heart, reduced filling, exercise intolerance, dyspnea. Many cases incidental. Exam trap. PPDH is not a traumatic hernia, it is congenital and often incidental. Partial or complete absence of the pericardial sac. Rare, usually incidental. No clinical significance. One reported dog with partial defect syncope, likely due to cardiac displacement. Intrapericardial cysts. Rare, benign, fluid-filled masses. Origin, congenital entrapment of omentum or falciform ligament. May be associated with PPDH. Encapsulated, hemorrhagic adipose tissue. Hemorrhage. Core concept, pericardial epicardial hemorrhage results from trauma, vascular rupture, or neoplasia. Causes. Penetrating wounds, foreign bodies, bullets, knives. Rib fractures. Blunt trauma, shear forces. Neoplasms, especially right atrial hemangiosarcoma. Rupture of weakened vessels. Exam tip, epicardial hemorrhage is common in septicemia, endotoxemia, anoxia, and electrocution, but those are typically diffuse petechiae, not massive hemopericardium. Effusions. The pericardium responds to fluid accumulation by dilation, but only if fluid accumulates slowly. Rapid accumulation, cardiac tamponade. Heart cannot expand. Sudden death. Hydropericardium. Definition: accumulation of clear, watery, serous transudate in pericardial sac. Mechanisms: testable. Hypoproteinemia. Liver disease. Protein losing nephropathy. Protein losing enteropathy. Starvation. Increased hydrostatic pressure. CHF, most common. Pulmonary hypertension, brisket disease. Vascular injury. Septicemia, pigs. African horse sickness. Bovine ephemeral fever. Heart water, Cowdria ruminantium. Gross features. Clear, light yellow fluid. Few fibrin strands if vascular injury present. Pericardium smooth and glistening, acute. Chronic cases: fibrous thickening, villous projections, especially over atria. Associations. Dilated cardiomyopathy, dogs, cats. Ascites syndrome, poultry. High altitude disease, cattle. Exam trap: hydropericardium is a transudate, not an exudate unless vascular injury adds fibrin. Hemopericardium. Definition: accumulation of whole blood in pericardial sac. Causes. Blunt trauma. Rupture of right atrial hemangiosarcoma, classic. Spontaneous atrial rupture in dogs. Rupture of intrapericardial aorta or pulmonary artery, horses. Complication of intracardiac injections. Pathophysiology. Rapid accumulation, cardiac tamponade, sudden death. Compression prevents diastolic filling, CO collapse. Exam tip: right atrial HSA is the most common cause of hemopericardium in dogs. Serous atrophy of fat. Core concept: occurs during starvation, anorexia, cachexia. Gross. Epicardial fat becomes gray, gelatinous, translucent. Most prominent along AV groove. Microscopic. Atrophic adipocytes. Edema in interstitium. Exam trap. Serous atrophy equals fat catabolism plus edema, not inflammation. Epicardial calcification. Causes. Hereditary calcinosis, mice. Cardiomyopathy, hamsters. Vitamin E selenium deficiency, sheep, cattle. Vitamin D toxicity. Calcinogenic plants, Cestrum diurnum, Solanum spp, Tricetum flavescens. Spontaneous myocardial calcification, aged rats, guinea pigs. Gross. White, gritty plaques on epicardial surface. Often accompanies myocardial mineralization. Exam tip: epicardial calcification is usually secondary to myocardial mineralization, not a primary lesion. Medium white star extra ACVP phase 2 exam tips for this section. PPDH is the most common congenital pericardial anomaly in cats, think Persians. Herniated liver in PPDH may develop myelolipomas, a classic association. Hydropericardium equals transudate, hemopericardium equals whole blood. Rapid fluid accumulation cardiac tamponade sudden death. Right atrial hemangiosarcoma equals number 1 cause of hemopericardium in dogs. Serous atrophy of fat equals gelatinous epicardial fat in starvation. Chronic hydropericardium villus fibrous projections on epicardium. Epicardial calcification often accompanies vitamin E selenium deficiency. African horse sickness and heart water cause hydropericardium via vascular injury. Intrapericardial cysts are benign and often incidental. Visceral gout, context note. Not reported in domestic mammals. Occurs in birds and reptiles. Uric acid crystal deposition on serosal surfaces, including pericardium. Covered in Chapter 1, Cell Injury. Exam tip: if you see chalky white serosal deposits on a bird heart, think visceral gout, not mineralization. Pericarditis. Core concept: pericarditis equals inflammation of the pericardium. Most commonly fibrinous, especially in bacterial septicemia. Fibrinous pericarditis. Gross. Yellow fibrin covering visceral plus parietal pericardium. Layers adhere when pulled apart, fibrin strands stretch. Classic descriptor: bread and butter heart. Microscopic. Eosinophilic fibrin layer. Neutrophils. Congested epicardium. Outcome. Early death common, highly virulent septicemias. If survival organization fibrous adhesions. Causes, high yield list. Cattle, Manhemia hemolytica, blackleg, carliform septicemia, contagious bovine pleuropneumonia, sporadic bovine encephalomyelitis. Fetal infections, Brucella spp, Truparella pyogenes. Sheep, Manhemia, Streptococcus spp. Exam trap: fibrinous pericarditis equals hematogenous spread of bacteria, not traumatic. Suppurative pericarditis. Classic species, cattle. Classic cause, traumatic reticuloperitonitis, hardware disease. Pathogenesis. Sharp metal object in reticulum penetrates diaphragm, enters pericardial sac. Introduces bacteria, purulent infection. Gross. Thickened pericardium. Shaggy, white, fibrous tissue. Foul smelling, thick, white-gray pus-filling sac. Outcome. Weeks to months survival. Death from CHF or septicemia. Exam tip: if you see shaggy, purulent pericarditis in a cow, the answer is hardware disease. Constrictive pericarditis. Core concept: chronic pericarditis, fibrous adhesions, rigid pericardial shell, impaired diastolic filling. Causes: chronic suppurative pericarditis, cattle; chronic fibrinous pericarditis, pigs; dogs with coccidioidomycosis. Pathophysiology: fibrous adhesions obliterate pericardial space. Heart cannot expand diastolic filling, CO. Compensatory myocardial hypertrophy. Eventually right-sided CHF. Exam trap: constrictive pericarditis equals diastolic failure, not systolic. Fibrinous pericarditis, expanded etiology list. Hematogenous spread of organisms such as Mannheimia hemolytica, Clostridium chauvoei, blackleg, coliforms, Mycoplasma mycoids, contagious bovine pleuropneumonia, Brucella SPP, fetal infections, Truparella pyogenes, fetal infections, Streptococcus SPP, sheep. Diagnostic note: sterile swabs of exudate recommended for culture. Medium White Star ACVP Phase 2 exam tips for this section. Bread and butter heart equals fibrinous pericarditis. Hardware disease equals suppurative pericarditis in cattle. Constrictive pericarditis, diastolic dysfunction plus right-sided CHF. Fibrinous pericarditis equals hematogenous, not traumatic. Purulent pericarditis equals direct inoculation, hardware. Fetal fibrinous pericarditis, think Brucella or Truparella. Birds with white serosal deposits, visceral gout, not mineralization. Chronic pericarditis, fibrous adhesions obliterating sac. Coccidioidomycosis can cause constrictive pericarditis in dogs. Disorders of the blood and lymphatic vascular systems. Disorders of blood vessels. Developmental errors, congenital anomalies. Failure of closure of fetal cardiovascular shunts. Portocaval shunts, portosystemic shunts. Core concept: portal blood bypasses the liver, toxins, especially ammonia, reach systemic circulation, hepatic encephalopathy. Types: congenital, persistent ductus venosus, extrahepatic shunts, small breed dogs, cats, intrahepatic shunts, large breed dogs, acquired, develop secondary to portal hypertension, caused by chronic fibrosis, neoplasia, caval obstruction, multiple tortuous collateral vessels, require time to form. Pathophysiology: portal blood bypasses hepatic sinusoids, hepatotrophic factors, hepatic atrophy, ammonia not detoxified, neurologic signs, elevated bile acids. Exam trap: congenital shunts equals small, normal colored liver. Acquired shunts equals multiple collateral vessels plus underlying liver disease. Tetralogy of Fallot. Covered earlier, cyanotic congenital defect with VSD plus pulmonic stenosis plus overriding aorta plus RV hypertrophy. Patent ductus arteriosus, PDA. Core concept: failure of ductus arteriosus to close left to right shunt, aorta pulmonary artery. Breed predispositions: poodle, polygenic, collie, Pomeranian, Chihuahua, Cocker Spaniel, Springer Spaniel, German Shepherd, Casehaunt, Maltese, Yorkie, Bichon Frise, Sheltie females, males. Pathophysiology: aortic pressure, pulmonary pressure, left to right shunt. Pulmonary overcirculation, pulmonary hypertension. LV preload, eccentric LV hypertrophy. Severe pulmonary hypertension, reversal right to left, PDA, cyanosis. Gross, dilated, funnel-shaped connection between descending aorta and pulmonary artery. Normally becomes ligamentum arteriosum. Exam trap. PDA is the most common congenital cardiac defect in dogs. Malpositioning of great vessels. Persistent right aortic arch, PRAA. Core concept. Right fourth aortic arch persists. Ligamentum arteriosum forms a vascular ring around esophagus plus trachea. Breed predispositions. German Shepherd, Irish Setter, Great Dane. Pathophysiology. Esophageal constriction megasophus. Regurgitation. Aspiration pneumonia. Exam trap. Megasophus in a young dog. Think PRAA. Transposition of the aorta and pulmonary artery. Severe anomaly. Aorta arises from RV, pulmonary artery from LV. Often accompanied by VSD. Incompatible with life unless mixing occurs. Truncus arteriosus. Single arterial trunk arises above a large VSD. Mixing of oxygenated plus deoxygenated blood. Hypoxemia plus cyanosis. Rare in animals. Hemothorax and hemoabdomen. Core concept. Blood in thoracic or abdominal cavity due to rupture of large vessels. Causes. Trauma. Ruptured aneurysm. Neoplasia. Spontaneous rupture of weakened vessels. Aneurysms. Definition. Localized dilation outpouching of a weakened vessel wall. Causes. Copper deficiency in pigs. Copper needed for elastin cross-linking. Spirocerca lupi in dogs. Aortic granulomas weaken wall. Strangulus vulgaris in horses. Verminous arteritis weakening. Idiopathic, most common. Dissecting aneurysms. Seen in birds, especially turkeys. Blood enters media dissects along wall. Often fatal. Exam trap. Copper deficiency aortic aneurysm plus rupture in pigs. Aortic rupture and rupture of large arteries. Horses. Rupture of ascending aorta or pulmonary artery near pulmonic valve. Occurs during exertion or thoracic trauma. Within pericardial sac, hemopericardium plus cardiac tamponade sudden death. Dogs. Spirocerca lupi granulomas weaken descending aorta rupture. Horses, guttural pouch. Internal carotid artery rupture epistaxis. Secondary to mycotic guttural pouch infection. Mares and cows. Middle uterine artery rupture during parturition or uterine torsion prolapse. Turkeys. Aortic rupture plus or minus dissection common cause of sudden death in males. High altitude disease, brisket disease, high mountain disease. Core concept, occurs in cattle and occasionally horses, pigs, at greater than 5,000 feet 1,524 meters. Driven by hypoxia-induced pulmonary vasoconstriction. Pathogenesis. Hypoxia pulmonary arterial vasoconstriction. Pulmonary arterial hypertrophy. Pulmonary hypertension. RV hypertrophy, RV dilation. Right-sided CHF. Lesions. Ascites. Hydrothorax. Hydropericardium. Pulmonary edema. Subcutaneous edema, brisket, submandibular. Exam trap. High altitude disease equals right heart failure due to pulmonary hypertension, not primary cardiac disease. Hemangiosarcoma. Core concept. Malignant endothelial neoplasm, common in dogs. Cardiac HSA. Usually arises in right atrial wall. Can metastasize from spleen. Causes hemopericardium, cardiac tamponade sudden death. Exam tip. Right atrial HSA is the #1 cause of hemopericardium in dogs. Cell degeneration and death in vessels. Generalized vascular degenerative diseases include arteriosclerosis, atherosclerosis, arterial medial calcification, hyaline degeneration, fibrinoid necrosis, amyloidosis. Exam trap: atherosclerosis is rare in animals, except hypothyroid dogs, diabetic dogs, cytosine birds, especially Amazons. Medium white star ACVP Phase 2 exam tips for this section. PDA equals left to right shunt, eccentric LV hypertrophy, reversal causes cyanosis. PRAA equals megasophus plus aspiration pneumonia in young dogs. Portosystemic shunts, hepatic encephalopathy plus small liver. Copper deficiency, aortic aneurysm in pigs. Spirocirca lupi, aortic rupture in dogs. Strongylus vulgaris, verminous arteritis plus aneurysm risk. High altitude disease equals hypoxia, pulmonary hypertension, right-sided CHF. Aortic rupture in horses, hemopericardium plus sudden death. Truncus arteriosus equals single arterial trunk plus VSD. Dissecting aneurysms, think turkeys. Cardiac HSA equals right atrial mass plus hemopericardium. Arteriosclerosis, atherosclerosis, and arterial medial calcification. These three lesions are often confused, but Phase 2 expects you to differentiate them instantly. Here's the clean breakdown. Arteriosclerosis. Core concept: age-related intimal fibrosis of large elastic arteries, hardening of the arteries. Key features: very common in aged animals. Rarely clinically significant. Most often affects abdominal aorta. Lesions cluster at branch points, turbulence. Gross. Slightly raised, firm, white plaques. Often subtle. Microscopic. Intimal thickening with mucolysaccharide accumulation. Later, smooth muscle proliferation plus fibrous tissue. Splitting fragmentation of internal elastic lamina. Pathogenesis. Chronic hemodynamic stress, endothelial injury, intimal proliferation. Not lipid-driven, unlike atherosclerosis. Exam trap: arteriosclerosis equals fibrosis, not lipid. Atherosclerosis equals lipid, not just fibrosis. Atherosclerosis. Core concept: intimal and medial lipid accumulation, atheromas, luminal narrowing. Frequency in animals. Rare in domestic mammals. Occurs naturally in aged pigs, birds, especially parrots, dogs with hyperthyroidism or diabetes mellitus, hypercholesterol. Species susceptibility, experimental. Susceptible: pig, rabbit, chicken. Resistant: dog, cat, cow, goat, rat. Gross. Thickened, firm, yellow-white arteries. Heart, mesentery, kidneys commonly affected. Microscopic. Lipid in smooth muscle cells plus macrophages, foam cells. Necrosis, fibrosis, mineralization in advanced lesions. In dogs, lipid distributed throughout the wall, not just intima, differs from humans. Pathogenesis, response to injury model. Endothelial injury, hyperlipidemia, oxidative stress. Lipoprotein entry into intima. Oxidation, cytotoxicity. Macrophage uptake, foam cells. Smooth muscle migration plus fibrosis. Plaque progression, narrowing, ulceration, thrombosis, aneurysm. Exam trap: atherosclerosis is not the cause of myocardial infarction in animals, infarction is rare. Arterial medial calcification. Core concept: mineralization of elastic and muscular artery media, often with concurrent endocardial mineralization. Causes: calcinogenic plants, Cestrum diurnum, Solanum spp, tricetum flavescens. Vitamin D toxicity. Renal insufficiency, hyperphosphatemia. Severe debilitation, John's disease in cattle. Spontaneous in horses, rabbits, aged guinea pigs, rats with chronic renal disease. Gross. Arteries become rigid, pipe-like, non-compressible. Raised, white, gritty plaques. Microscopic. Elastic arteries, basophilic granular mineral on elastic fibers. Muscular arteries, complete circumferential ring of mineralization. Siderocalcinosis in aged horses. Iron plus calcium deposition in cerebral arteries. Incidental, no brain lesions. Exam trap, arterial medial calcification not equal to atherosclerosis. There is no lipid, only mineral. Medium white star ACVP phase 2 exam tips for this section. Arteriosclerosis equals intimal fibrosis, age-related. Atherosclerosis equals lipid plus foam cells, rare in animals, think hypothyroid diabetic dogs. Medial calcification equals mineral, not lipid, arteries become pipe-like. Parrots and pigs are the classic species for natural atherosclerosis. Dogs with hyperthyroidism, hypercholesterol atherosclerosis. Siderocalcinosis in horses is incidental. John's disease cattle often have arterial plus endocardial mineralization. Atherosclerosis in animals rarely causes infarction, unlike humans. Arteriosclerosis lesions cluster at branch points due to turbulence. Hyaline degeneration, fibrinoid necrosis, and amyloidosis. These three lesions all affect small muscular arteries and arterioles and all appear as homogeneous eosinophilic material in the vessel wall, but they differ in composition, causes, and diagnostic stains. Shared features. Occur in all species. Usually not grossly visible. When severe, especially fibrinoid necrosis, can cause hemorrhage and edema in affected organs. All produce a glassy, eosinophilic, smudged appearance of the vessel wall on H&E. Special stains are essential to differentiate them.
1.
Amyloidosis. Definition: deposition of amyloid protein in vessel walls, rigid, fragile vessels. Stains: Congo red, apple green birefringence. Methyl violet metachromasia. Where it occurs: small muscular arteries of myocardium, lungs, spleen of old dogs. Also occurs in systemic amyloidosis, kidney, liver, spleen. Consequences: vessel fragility, ischemia. In intramyocardial arteries, small myocardial infarcts. Exam trap: amyloid is the only one of the three that is Congo red positive.
2.
Hyaline degeneration. Definition: accumulation of proteinaceous, amorphous, eosinophilic material in vessel walls. Stains: negative on Congo red. Negative on PAS, distinguishes from fibrinoid. Where it occurs: small muscular arteries of old dogs, myocardium, lungs, spleen. Often incidental. Pathogenesis: chronic plasma protein leakage across mildly damaged endothelium. Smooth muscle degeneration. Exam trap: hyaline degeneration is bland, not inflammatory, and not associated with acute necrosis.
3.
Fibrinoid necrosis. Definition: acute, severe vascular injury with deposition of serum proteins plus fibrin into the vessel wall, obliteration of cellular detail. Stains: PAR positive, fibrinoid material stains red. Congo red negative. Microscopic appearance: intensely eosinophilic collar replacing vessel wall. Loss of nuclei, often accompanied by perivascular hemorrhage and edema. Causes: uremia, dogs. Hypertension, rare in animals but classic when present. Immune-mediated vasculitis. Acute severe inflammation. Endothelial injury from toxins or infectious agents. Consequences: vessel rupture, hemorrhage. Ischemia, infarction, especially myocardium, kidney, intestine. Exam trap: fibrinoid necrosis equals acute, necrotizing, PAS positive, and associated with endothelial injury. Putting them together, phase 2 style logic. If you see Congo red positive amyloid, PAR positive, necrotizing, intensely eosinophilic fibrinoid necrosis. PAR negative, smooth, glassy, non-necrotizing hyaline degeneration. Omphalophlebitis, navel ill. Core concept: neonatal infection of the umbilical vein, septicemia and metastatic infections. Pathogenesis: umbilicus contaminated at birth. Bacteria ascend umbilical vein, liver. Umbilical vein drains to liver. Can cause septicemia, suppurative polyarthritis, hepatic abscesses, umbilical abscesses. Species: calves, lambs, foals, most common in farm animals. Exam trap: umbilical vein, liver abscesses, not kidneys. Jugular thrombophlebitis. Core concept: inflammation plus thrombosis of the jugular vein, usually due to indwelling catheters. Risk factors: catheter placement, hypoproteinemia, salmonellosis, endotoxemia, large intestinal disease, horses. Consequences: thrombosis, embolism, local swelling, pain, septic emboli, lungs. Exam trap: always think catheter-associated endothelial injury plus hypercoagulability. Medium white star ACVP phase 2 exam tips for this section. Amyloid equals Congo red positive, birefringent, chronic. Hyaline degeneration equals bland, PAS negative, age-related. Fibrinoid necrosis equals acute, PAS positive, necrotizing, inflammatory. Intramyocardial amyloid or hyaline degeneration in old dogs, tiny myocardial infarcts. Fibrinoid necrosis is classic in uremic dogs and hypertensive dogs. Omphalophlebitis, liver abscesses because the umbilical vein drains to the liver. Jugular thrombophlebitis equals catheter plus hypercoagulability plus endotoxemia. Fibrinoid necrosis is the only one associated with vessel rupture and hemorrhage. Disorders of lymphatic vessels. Developmental errors, congenital anomalies. Lymphangiectasia. Core concept: dilation of lymphatic vessels due to congenital malformation or secondary obstruction. Causes: congenital, malformed or hyperplastic lymphatics, rare. Acquired: neoplastic obstruction, granulomatous inflammation. Fibrosis: increased lymphatic pressure from intestinal disease. Consequences: protein-rich lymph leakage, intestinal lymphangiectasia, protein losing enteropathy, dogs. Peripheral lymphangiectasia, localized edema. Exam trap: lymphangiectasia equals dilated lymphatics, not inflammation. Lymphangitis equals inflamed lymphatics. Hereditary lymphedema. Core concept: congenital failure of lymphatic vessel development, persistent subcutaneous edema. Species: dogs. Ayrshire and Angus calves. Pigs. Pathogenesis: aplasia or hyperplasia of lymphatic vessels. Poor lymph drainage, chronic edema. Calves: severe swelling of ear tips is classic. Exam trap: hereditary lymphedema equals primary lymphatic vessel defect, not cardiac or renal disease. Rupture of the thoracic duct chylothorax. Core concept: leakage of chyle, lymph plus triglyceride-rich fat into the thoracic cavity. Causes: trauma, spontaneous rupture, obstruction of thoracic duct or venous return, right-sided heart failure, neoplasia, granulomas, cranial vena cava thrombosis, dirophilariasis, idiopathic, common in cats. Consequences: chylous effusion, restrictive lung expansion. Chronic cases: fibrosing pleuritis. Exam trap: chylothorax fluid equals milky, triglyceride-rich, lymphocyte predominant. Lymphedema. Core concept: accumulation of interstitial fluid due to impaired lymphatic drainage, not due to hydrostatic or oncotic forces. Mechanisms: 6 categories. Overload, excess lymph production. Inadequate collection. Abnormal lymphatic contractility. Insufficient lymphatic vessels. Lymph node obstruction. Structural defects in lymphatics. Primary lymphedema. Aplasia, hyperplasia, or dysplasia of lymphatics. Rare in cats, more common in dogs. Usually distal limbs, hind limbs. Secondary lymphedema. Neoplasia. Radiation. Surgery. Parasitic infection, Brugia spp. In cats in tropical regions. Chronic lymphedema. Leads to fibrosis, worsens drainage, vicious cycle. Exam trap: lymphedema equals protein-rich interstitial fluid, unlike hydrostatic edema. Lymphangioma, lymphangiosarcoma. Lymphangioma. Rare, benign. Composed of dilated lymphatic channels. Usually incidental. Lymphangiosarcoma. Malignant. More common than lymphangioma. Neoplastic lymphatic endothelial cells. Spaces contain lymph, not blood. Lymphatic invasion is a major route of metastasis for carcinomas. Exam trap: lymphangiosarcoma not equal to hemangiosarcoma. HSA contains blood, lymphangiosarcoma contains lymph. Lymphangitis. Core concept: inflammation of lymphatic vessels, common in infectious diseases. Gross. Thick, firm, cord-like lymphatic vessels. May ulcerate and drain pus. Lymphedema may accompany. Causes: bacterial, fungal, parasitic infections. Cutaneous infections of distal limbs. Chronic nodular lymphangitis in horses, Corynebacterium pseudotuberculosis, Histoplasma falciparum. Granulomatous lymphangitis in John's disease, mesenteric lymphatics. John's disease. Granulomatous enteritis plus granulomatous lymphangitis. Mesenteric lymphatics become thickened, prominent, cord-like. Exam trap: John's disease equals granulomatous lymphangitis plus granulomatous enteritis. Medium white star ACVP phase 2 exam tips for this section. Lymphangiectasia equals dilated lymphatics, not inflamed. Lymphangitis equals inflamed lymphatics, often cord-like and nodular. Hereditary lymphedema equals primary lymphatic aplasia-hyperplasia. Chylothorax equals thoracic duct rupture or obstruction, fluid is milky and triglyceride-rich. Brugia spp. Secondary lymphedema in cats, tropical regions. Chronic lymphedema, fibrosis, irreversible swelling. Lymphangiosarcoma equals malignant lymphatic endothelial tumor, contains lymph, not blood. John's disease equals granulomatous lymphangitis of mesenteric lymphatics. Diseases of horses, high-yield ACVP rewrite. White snakeroot induced myocardial degeneration. Agent, Eupatorium rugosum, white snakeroot, toxin, trematol, requires hepatic P450 activation. Mechanism. Exact mechanism unclear. Likely mitochondrial oxidative phosphorylation inhibition. Disrupts TCA cycle ATP depletion cardiomyocyte necrosis. Lesions. Gross. Pale white tan streaks throughout myocardium. May have fibrinous pericardial effusion, modified transudate. Microscopic. Multifocal myocardial degeneration plus necrosis. Vacuolated cytoplasm. Loss of cross striations. Hyperiocinophilia, fragmentation. Pycnosis karyolysis. Later, fibrosis, reparative. Exam trap. White snakeroot causes both cardiac and skeletal muscle necrosis, similar to ionophores and gossypal. Ionophore-induced myocardial degeneration. Covered earlier identical lesion pattern to white snakeroot, but mechanism is cation dysregulation, intracellular Ca². Fibrinous pericarditis, equine. Causes. Actinobacillus spp. Streptococcus spp. Mycoplasma spp. Equine herpes virus 1 and 2. Equine influenza virus. Mare reproductive loss syndrome, eastern tent caterpillar exposure. Lesions. Yellow fibrin covering pericardium. Adhesions if chronic. Must culture pericardial exudate. Exam trap. Fibrinous pericarditis in horses equals hematogenous spread, not traumatic. Equine viral arteritis, EVA. Agent, equine arteritis virus tropism, vascular endothelial cells. Lesions. Microscopic. Fibrinoid necrosis of small muscular arteries. Edema. Mononuclear infiltrates. Thrombosis. Gross. Severe subcutaneous edema, especially limbs, ventrum. Edematous lymph nodes. Edematous intestinal wall plus mesentery. Serous effusions, thorax, abdomen. Pulmonary edema. Exam trap. EVA equals viral vasculitis with fibrinoid necrosis, similar pattern to African horse sickness. African horse sickness, subacute cardiac form. Agent, orbovirus, culicoids borne. Pathogenesis. Virus introduced by midge bite. Replication in local lymph nodes. Viremia. Tropism for endothelial cells, monocytes, macrophages. Vascular permeability edema, hemorrhage, microthrombosis. Lesions. Gross. Massive hydropericardium. Subcutaneous plus intermuscular edema of head neck. Epicardial plus endocardial hemorrhages. Microscopic. Endothelial degeneration plus necrosis. Myocardial edema, hemorrhage. Focal myocardial necrosis with inflammatory infiltrates. Exam trap. Cardiac form equals hydropericardium, respiratory form equals massive pulmonary edema. Cranial mesenteric arteritis and thrombosis, Strongylus vulgaris. Agent, Strongylus vulgaris L4 migration. Pathogenesis. Larvae migrate through intestinal arteries. Severe lesions at cranial mesenteric artery origin. Endarteritis, thrombosis, emboli colic. Lesions. Gross. Enlarged, thickened, fibrotic artery. Roughened intima with adherent thrombus plus or minus larvae. Microscopic. Heavy inflammatory infiltrates. Fibroblast proliferation. Thrombi containing larvae. Exam trap. Despite thrombosis, intestinal infarction is rare due to extensive collateral circulation. Aortoiliac thrombosis. Cause, often attributed to Strangulus vulgaris migration clinical sign. Exercise-induced hind limb weakness. Improves with rest. Exam trap, posterior weakness after exercise equals aortoiliac thrombosis. Arterial intimal calcification, intimal bodies. Small mineralized nodules in subendothelium of small muscular arteries. Common incidental finding in horses. No clinical significance. Exam trap, do not confuse with arterial medial calcification, vitamin D toxicity, calcinogenic plants. Glander's disease, Farsi, cutaneous form. Agent, Burkholderia malayi distribution, horses, donkeys, mules, eradicated in many regions. Pathogenesis. Ingestion pharyngeal entry hematogenous spread skin. Lesions. Gross. Multiple ulcerated nodules along lymphatic vessels. Linear beaded pattern. Thickened, tortuous lymphatics. Suppurative discharge. Microscopic. Pyogranulomatous inflammation. Suppurative lymphangitis. Exam trap, glanders equals ulcerative lymphangitis with nodules arranged along lymphatic vessels. Miscellaneous cutaneous lymphangiotides. Mimic glanders, differentiation requires culture or cytology. Causes. Ulcerative lymphangitis, Corynebacterium pseudotuberculosis. Sporadic lymphangitis, unknown cause. Epizootic lymphangitis, Histoplasma farciminosum. Melioidosis, Burkholderia pseudodermale. Lesions. Raised, firm nodules, 1 to 2 centimeters. Draining tracts. Linear beaded pattern along lymphatics. Thick white-yellow pus. Pyogranulomatous inflammation. Exam trap, epizootic lymphangitis equals Histoplasma farciminosum, not H. capsulatum. Chronic progressive lymphedema, corporal, in draft horses. Core concept, debilitating distal limb disorder with suspected genetic elastin metabolism defect lymphatic dysfunction. Lesions. Gross. Distal limb swelling, pitting edema. Thickened, scaling skin. Exudation, erosions, ulcerations. Secondary bacterial infections common. Microscopic. Markedly dilated dermal lymphatics. Dermal fibrosis, chronic cases. Epidermal acanthosis, pustules, erosions. Folliculitis, deep dermal abscesses. Elastin stains. Superficial dermis, excessive, disorganized elastin. Deep dermal lymphatics, lack normal elastin fibers. Exam trap, corporal equals lymphatic dysfunction plus elastin abnormality, not just infection. Medium white star ACVP phase 2 exam tips for this section. White snakeroot equals mitochondrial toxin myocardial necrosis. EVA plus African horse sickness equals viral vasculitis with fibrinoid necrosis. Strangulus vulgaris equals cranial mesenteric arteritis plus thrombosis, infarction rare. Aortoiliac thrombosis equals exercise-induced hind limb weakness. Glanders equals ulcerative lymphangitis with nodules along lymphatics. Epizootic lymphangitis equals Histoplasma farciminosum. Corporal equals elastin defect plus lymphatic dilation plus chronic edema. Intimal bodies equals incidental mineral nodules, not pathologic. Diseases of ruminants, cattle, sheep, goats. Ultra high yield ACVP phase 2 rewrite. Blackleg myocarditis, Clostridium chauveau. Core concept, blackleg equals acute necrotizing myositis plus hemorrhagic myocarditis. Mechanism. Spores ingested latent in muscle trauma hypoxia germination. exotoxins, hemorrhage, necrosis, emphysema, lesions. Hemorrhagic myocarditis, classic. Skeletal muscle, dark, dry, emphysematous, crackly. Myocardium, hemorrhage, necrosis, gas bubbles. Exam trap, blackleg myocarditis is hemorrhagic, unlike most other necrotizing myocarditides. East Coast fever, Theileria parva. Agent, tick-borne protozoan, Theileria parva, species, cattle, sheep, goats, Africa. Lesions. Myocardial necrosis plus inflammation. Lymphoid hyperplasia, lymphoid depletion. Pulmonary edema, hydrothorax. Exam trap, Theileria infects lymphocytes, causing a lymphoproliferative-like disease. Foot and mouth disease, FMD. Agent, aphthvirus species, young lambs, piglets, myocarditis form. Lesions. Multifocal myocardial necrosis plus apoptosis. Mononuclear infiltrates. May occur before vesicular lesions. Exam trap, FMD myocarditis in neonates equals tiger heart, pale streaks. Malignant catarrhal fever, MCF. Agent, ovine herpes virus 2, sheep-associated form. Mechanism. Infects endothelial cells, lymphocytes, macrophages. Causes lymphocytic vasculitis and fibrinoid necrosis. Lesions. Transmural lymphocytic arteritis, periarteritis. Necrosis of tunica media. Endophlebitis. Ulcerative mucosal lesions, lymphadenopathy. Exam trap, MCF equals lymphocytic vasculitis, not neutrophilic. High altitude disease, brisket disease. Covered earlier, hypoxia, pulmonary hypertension, right-sided CHF. Eosinophilic myocarditis. Cause. Parasitic infections, especially sarcocystis. Lesions. Eosinophil-rich myocarditis. Often incidental and less severe. Exam trap, eosinophilic myocarditis in ruminants, think parasites, not hypersensitivity. Valvular hematomas, hematocysts. Common in postnatal calves. Blood-filled cysts on AV valves. Regress spontaneously. No functional significance. Valvular lymphocysts. Yellow, serum-filled cysts on AV valves. Also incidental. Exam trap, hematocysts equals blood, lymphocysts equals serous fluid. Vegetative valvular endocarditis. Core concept, bacterial infection, large friable vegetations on valves. Lesions. Yellow-gray friable vegetations. Fibrin plus bacterial colonies. Underlying granulation tissue. Valve order of frequency. Mitral aortic, tricuspid pulmonary. Exam trap, ruminants often have Truparella pyogenes or Streptococcus spp. Involvement. Endocardial mineralization. Occurs with vitamin D toxicity. Calcinogenic plants. Chronic wasting diseases, Johns. Uremia. Exam trap, Johns disease, intimal mineralization plus granulomatous lymphangitis. Fibrinous pericarditis, ruminants. Causes. Manhemia hemolytica. Blackleg. Carliform septicemia. Contagious bovine pleuropneumonia. Sporadic bovine encephalomyelitis. Brucella spp. Fetal. Truparella pyogenes, fetal. Mycoplasma mycoids, goats. Lesions. Yellow fibrin covering pericardium. Adhesions if chronic. Exam trap, Fibrinous pericarditis equals hematogenous spread, not trauma. Suppurative pericarditis, traumatic reticulopericarditis. Cause, hardware disease, cattle. Pathogenesis. Sharp metal object penetrates reticulum diaphragm pericardium. Introduces bacteria suppurative pericarditis. Lesions. Thick, shaggy fibrous tissue. Foul-smelling purulent exudate. Leads to CHF plus septicemia. Exam trap, hardware disease equals suppurative, not fibrinous. Thrombotic meningoencephalitis, TME. Agent, Histophilus somni. Mechanism. Septic vasculitis, vascular necrosis, thrombosis, infarction. Lesions. CNS. Multifocal infarcts. Vasculitis, thrombosis. Neutrophils plus macrophages. Gram-negative bacilli in thrombi. Heart. Necrotizing myocarditis, especially LV papillary muscle. Exam trap, TME thrombi are mural, not embolic. Thrombosis of the caudal vena cava. Cause. Hepatic abscess ruptures into hepatic vein or caudal vena cava. Septic thrombus forms. Consequences. Septic emboli to lungs. Pulmonary abscesses. Hemoptysis. Sudden death. Exam trap, caudal vena cava thrombosis equals pulmonary abscesses plus hemoptysis. Foreign parasitic diseases, tropical. Schistosomiasis, schistosoma SPP. Adult flukes in mesenteric plus portal veins. Causes phlebitis, intimal proliferation, thrombosis. Exam trap, schistosoma eggs granulomatous inflammation in liver intestine. John's disease. Granulomatous enteritis. Granulomatous lymphangitis of mesenteric lymphatics. Intimal mineralization of vessels. Anthrax. Agent, Bacillus anthracis form, acute, fatal septicemia. Key features. Dark, thick, unclotted blood from orifices. Do not necropsy, spore contamination risk. If necropsied accidentally. Massive splenomegaly, blackberry jam spleen. Widespread serosal hemorrhages. Edematous lymph nodes. Large numbers of bacilli in blood. Exam trap, anthrax blood is unclotted due to toxin-mediated inhibition of coagulation. Medium white star ACVP phase 2 exam tips for ruminants. Blackleg myocarditis equals hemorrhagic. FMD myocarditis in neonates equals tiger heart. MCF equals lymphocytic vasculitis plus fibrinoid necrosis. Hardware disease equals suppurative pericarditis. TME equals mural thrombi, not embolic. Caudal vena cava thrombosis equals pulmonary abscesses plus hemoptysis. Anthrax equals unclotted blood plus blackberry jam spleen. Schistosomiasis equals phlebitis plus thrombosis in portal mesenteric veins. Johns equals granulomatous lymphangitis plus vascular mineralization. Diseases of pigs ACVP phase 2 high yield rewrite. Encephalomyocarditis, EMC. Agent, encephalomyocarditis virus, cardiovirus, picornaviridae, strain. Type B affects multiple species, but pigs are most susceptible. Lesions. Gross. Multifocal pale areas in myocardium. Microscopic. Multifocal myocardial necrosis. Mononuclear inflammatory infiltrates. Other viral causes of myocarditis in pigs. Porcine parvovirus. Porcine circovirus 2, PCV2, part of post-weaning multisystemic wasting syndrome, PMWS. Exam trap. EMC myocarditis looks similar to PCV2 myocarditis, but PCV2 has lymphoid depletion plus granulomatous inflammation elsewhere. Endocarditis. Very common in pigs due to septicemia. Most common organisms. Streptococcus spp. Erysipelathrix rhusiopathiae. Lesions. Large, friable, yellow-grey vegetations. Often occlude valve orifice. Fibrin plus bacterial colonies plus granulation tissue. Exam trap. Erysipelathrix diamond skin disease plus valvular endocarditis. Fibrinous pericarditis. Causes. Glasses disease, Glycerella parasuis. Streptococcus spp. Mycoplasma hypopneumoniae, enzootic pneumonia. Salmonella spp. Lesions. Yellow fibrin covering pericardium. May progress to fibrous adhesions. Exam trap. Glasses disease equals polycerositis, pleuritis, pericarditis, peritonitis. Porcine polycerositis, Glasses disease, Streptococcus suis 2. Agents. Glycerella parasuis. Streptococcus suis type 2. Lesions. Fibrinous polycerositis. Arthritis. Meningitis, especially S. suis. Exam trap. Glasses equals younger pigs, 5 to 12 weeks, fibrinous serositis. S. suis equals meningitis plus septicemia. Dietary microangiopathy, Mulberry heart disease. Cause, vitamin E and/or selenium deficiency. Mechanism. Oxidative injury to vascular endothelium. Fibrinoid necrosis of small arteries arterioles. Thrombosis microhemorrhages. Lesions. Gross. Epicardial hemorrhages, especially over right atrium Mulberry heart. Hydropericardium. Concurrent hepatosis dietetica, massive hepatic necrosis. Microscopic. Widespread fibrinoid necrosis of small vessels. Endothelial damage. Fibrin thrombi in myocardial capillaries. Exam trap. Mulberry heart disease equals vascular lesion, not primary myocardial degeneration. Fibrinoid necrosis of blood vessels, pigs. Very common and diagnostically important. Seen in vitamin E selenium deficiency, heart. Edema disease, gastric submucosa. Cerebrospinal angiopathy. PCV2 vasculopathy. Organic mercury toxicosis, meninges. Lesions. PAR-positive fibrinoid material. Necrosis of vessel wall. Edema plus hemorrhage. Exam trap. Edema disease equals E. coli F18AB vascular necrosis in gastric submucosa plus brainstem. Medium white star ACVP phase 2 exam tips for pigs. EMC virus multifocal myocardial necrosis plus mononuclear infiltrates. Erysipelathrix valvular endocarditis plus skin lesions. Glasses disease equals fibrinous polycerositis in young pigs. S. suis equals meningitis plus septicemia plus possible polycerositis. Mulberry heart disease equals vitamin E selenium deficiency fibrinoid necrosis plus epicardial hemorrhage. Hepatosis dietetica equals massive hepatic necrosis, same deficiency. Edema disease equals fibrinoid necrosis of arterioles in gastric submucosa plus CNS. PCV2 myocarditis occurs with lymphoid depletion and granulomatous inflammation elsewhere. Edema disease, cerebrospinal angiopathy. Agent, hemolytic E. coli strains producing Shiga-like toxin 2E, SLT2E, signalment, fast-growing, recently weaned pigs. Mechanism. Toxin targets vascular endothelium. Causes fibrinoid necrosis of arterioles. Leads to increased vascular permeability edema. Lesions. Gross. Prominent in gastric submucosal arterioles. Edema of eyelids, stomach, mesocolon. CNS edema. Neurologic signs. Microscopic. Fibrinoid necrosis of arterioles. Perivascular edema. In CNS, cerebrospinal angiopathy, ataxia, paddling, sudden death. Exam trap. Edema disease equals E. coli F18AB plus vascular necrosis, not enteritis. Erysipelosis, erysipelathrix rheusiopathii, ***. Cutaneous lesions. Square to rhomboid, raised, pink-purple plaques, diamond skin disease. Caused by vasculitis plus thrombosis plus ischemic infarction. Mechanism. Bacterial septicemia, embolization to skin, thrombosis plus ischemic infarction. Thrombosis of dermal vessels, sharply demarcated infarcts. Exam trap. Diamond skin lesions equals vascular infarcts, not dermatitis. Porcine polycerositis, Streptococcus suis 2, ***. Agent, Streptococcus suis type 2, one of several polycerositis pathogens. Lesions. Fibrinous polycerositis, pleuritis, pericarditis, peritonitis. Vasculitis of serosal vessels. Fibrin deposition due to endothelial injury plus endotoxin. May progress to microthrombi and DIC. Mechanism. Bacteremia, endothelial tropism. Increased vascular permeability, fibrinogen leakage, fibrin. Exam trap. S sways 2 equals meningitis plus septicemia plus polycerositis. African swine fever, ASF. Names: warthog disease, African pig disease agent, ASF virus, large DNA virus. Transmission. Soft ticks, Ornithodoros mubata. Ingestion of infected tissues. Direct contact. Mechanism. Virus replicates in tonsils plus lymph nodes, viremia. Infects macrophages plus lymphocytes. Causes thrombocytopenia, coagulation dysfunction, vascular leakage. Lesions. Gross. Widespread congestion, edema, hemorrhage. Hemorrhagic lymph nodes. Splenomegaly. Petechiae in renal cortex, epicardium, serosal surfaces. Pulmonary edema, hydrothorax. Microscopic. Vascular congestion plus hemorrhage. Fibrin microthrombi. Massive lymphoid necrosis. Exam trap. ASF and CSF are clinically indistinguishable, both cause hemorrhagic disease with lymphoid necrosis. Hog cholera, classical swine fever, CSF. Agent, pestivirus, RNA virus. Transmission. Direct contact. Ingestion of infected pork. Replicates in tonsils, viremia. Mechanism. Infects endothelial cells, macrophages, epithelial cells. Causes vascular injury, thrombocytopenia, DIC. Lesions. Gross. Widespread petechiae, kidney, bladder, larynx, gastric mucosa, epicardium. Hemorrhagic lymph nodes. Splenic infarcts, pathognomonic. Button ulcers in colon, chronic cases. Microscopic. Endothelial hydropic degeneration plus proliferation. Fibrinoid necrosis of vessels. Fibrin deposition in media plus intima. Congestion, thrombosis, infarction. Diffuse non-suppurative encephalitis. Exam trap. CSF equals button ulcers plus splenic infarcts. ASF equals no button ulcers, but more severe lymphoid necrosis. Medium White Star ACVP Phase 2 exam tips for this section. Edema disease equals SLT2E toxin fibrinoid necrosis of arterioles, gastric submucosa plus CNS. Diamond skin disease equals erysipelathrix vasculitis plus thrombosis infarcts. Sways 2 equals polycerositis plus meningitis. Glasses disease, G. parasuis, equals polycerositis, but younger pigs and less meningitis. ASF versus CSF, both hemorrhagic, but CSF has button ulcers plus splenic infarcts. ASF causes massive lymphoid necrosis and is tick-borne. Fibrinoid necrosis in pigs equals think vitamin E selenium deficiency, edema disease, PCV2, mercury, mulberry heart disease. Diseases of dogs ACVP Phase 2 high-yield rewrite. Dilatative, congestive, cardiomyopathy, DCM. Core concept, a primary myocardial disease causing systolic dysfunction, biventricular dilation, and CHF. Signalment. Large giant breeds, Doberman, Great Dane, Irish Wolfhound, Scottish Deerhound, Newfoundland, Saint Bernard, Afghan Hound, Old English Sheepdog, Portuguese Water Dog. Also, Boxers, Dalmatians. Small breed exception, English Cocker Spaniel. Often male. Familial, autosomal recessive or X-linked patterns. Lesions. Gross. Rounded, enlarged heart. Biventricular dilation. Diffusely thickened, white endocardium, fibrosis. Microscopic. Often mild or absent. Interstitial fibrosis. Fatty infiltration. Myocyte degeneration. Attenuated wavy fibers, classic but nonspecific. Exam trap, DCM in Dobermans is strongly associated with orothethmogenic sudden death, even before overt dilation. Hypertrophic cardiomyopathy, HCM. Covered in the multispecies section, rare in dogs, common in cats. Patent ductus arteriosus, PDA. Covered in the congenital vascular anomalies section, very common in dogs. Cardiac neoplasms. Dogs have the widest variety of cardiac tumors among domestic species. Primary tumors. Hemangiosarcoma, HSA, most common. Usually right atrial wall. Causes hemopericardium cardiac tamponade. Chemodectoma, aortic body tumor, heart base. Brachycephalic breeds predisposed. Ectopic thyroid parathyroid carcinoma. Mesothelioma. Thymoma. Granular cell tumor. Sarcomas, osteosarcoma, chondrosarcoma, fibrosarcoma, rhabdomyosarcoma, neurofibrosarcoma. Malignant mixed mesenchymal tumor. Secondary, metastatic, tumors. Very common, 36% of dogs with cardiac tumors have metastases. Common sources, melanoma, lymphoma, mammary carcinoma, hemangiosarcoma. Exam trap, right atrial HSA plus hemopericardium equals classic sudden death scenario. Canine parvovirus myocarditis. Agent, CPV2 signalment, puppies, 3 to 8 weeks, before intestinal crypts become primary target. Lesions. Gross. Pale, flabby heart. Acute CHF signs. Microscopic. Lymphocytic myocarditis. Myocyte necrosis. Large basophilic intranuclear viral inclusions, in survivors. Fibrosis in chronic survivors. Exam trap, parvomyocarditis equals no intestinal lesions, unlike classic enteric parvo. Figure 10.81 Parvovirus myocarditis, heart, dog. A. Note the multifocal pale areas, arrow, in the ventricular myocardium. B. Parvovirus infection, section of myocardium. An intranuclear basophilic inclusion body is in a myocyte, arrow. Hematoxylin and eosin, H&E, stain. A courtesy Dr. B. Weeks, College of Veterinary Medicine, Texas A&M University, and Noah's Archive, College of Veterinary Medicine, the University of Georgia. B. Courtesy School of Veterinary Medicine, Purdue University. Trypanosoma cruzi, Chagas disease. Agent, Trypanosoma cruzi vector, kissing bug, triatomony. Forms. Acute, young dogs less than 1 year. Lymphohistiocytic myocarditis. Right-sided CHF. Ascites, hepatosplenomegaly, lymphadenomegaly. Gross, yellow-white streaks plus or minus hemorrhage. Chronic, older dogs. Chronic lymphocytic plasmacytic myocarditis. Progressive myocardial fibrosis. Biventricular dilation, flaccid heart. Fibrous plaques. Exam trap, Chagas disease equals protozole myocarditis plus conduction disturbances plus CHF. Neurogenic cardiomyopathy, heart-brain syndrome. Core concept, myocardial necrosis triggered by massive catecholamine release after severe CNS trauma. Signalment. Dogs with diffuse CNS injury, e.g., hit by car. Mechanism. Excess sympathetic discharge coronary vasoconstriction plus direct myocyte toxicity. Delayed necrosis, 5 to 10 days post-trauma. Lesions. Gross. Numerous pale streaks in myocardium. Often affects LV papillary muscles. Microscopic. Myocyte necrosis. Contraction band necrosis possible. Minimal inflammation. Exam trap, heart-brain syndrome equals delayed myocardial necrosis after CNS trauma. Medium white star ACVP phase 2 exam tips for dogs. DCM equals biventricular dilation plus attenuated wavy fibers. Dobermans and Great Danes are classic. Parvomyocarditis equals lymphocytic, with intranuclear inclusions in survivors. Chagas equals protozole myocarditis, acute vs chronic forms. Neurogenic cardiomyopathy equals catecholamine-induced necrosis, especially papillary muscles. Right atrial HSA equals hemopericardium plus sudden death. Chemodectomas equals heart-based tumors in brachycephalics. Metastatic cardiac tumors are common, 36%. Myxomatous valvular degeneration, MVD valvular endocardiosis. The single most common cardiovascular disease of dogs. The single most common cause of CHF in older dogs. Signalment and genetics. Middle-aged to old dogs, especially small, toy, and medium breeds. Males develop disease earlier. Polygenic inheritance in Dachshunds and Cavalier King Charles Spaniels, CKCS. CKCS. Greater than 50% affected by 4 years. 100% affected by 10 years. Classic exam breed. High incidence breeds. Cocker Spaniel, Lhasa Apso, Bichon Frise, Yorkshire Terrier, Shih Tzu, Dachshund, Poodle, Pomeranian, Miniature Schnauzer, Chihuahua, Fox Terrier, Boston Terrier, Pekingese. Valve distribution, necropsy data from 3245 dogs. Mitral only 57.3%. Mitral plus tricuspid 26.6%. Tricuspid only 7.5%. Aortic 2.1%. Pulmonic 0.4%. Combinations 6.1%. Exam trap, mitral valve is overwhelmingly the most affected. Gross pathology. Valves are shortened, thickened, nodular. Smooth and shiny, not rough like endocarditis. Lesions worsen with age. Gross classification, types 1 to 4. Type 1. Few small nodules at leaflet contact points. Mild diffuse opacity proximally. Type 2. Larger nodules that coalesce. More diffuse opacity. Type 3. Large coalescing nodules forming plaque-like deformities. Extend into proximal chordae tendineae. Type 4. Ballooning of valve cusp. Thickened chordae tendineae. Severe distortion. Functional consequences. Valvular insufficiency regurgitation, left atrial dilation. Jet lesions. Raised, rough, firm streaks of endocardial fibrosis. Caused by high-velocity regurgitant jets striking atrial wall. CHF, left-sided pulmonary edema, may progress to right-sided. Severe complications. Chordae tendineae rupture, acute pulmonary edema. Left atrial wall rupture, hemopericardium plus cardiac tamponade. Acquired ASD, rare. Histopathology. Normal valve layers. Atrialis, endothelium plus elastic fibers. Spongiosa, loose connective tissue. Fibrosa, dense collagen, continuous with chordae. Ventricularis. MVD lesions. Predominantly in distal third of leaflet. Expansion of spongiosa. Disruption of fibrosa. Myofibroblastic proliferation. Accumulation of acid mucolisaccharides, mysomatous matrix. Chordae may be thickened or ruptured. Exam trap. Do not confuse normal age-related thickening with MVD. Clinically relevant when valve plus chordae are thickened ruptured. Left heart chambers are enlarged. Jet lesions present. Associated myocardial changes. Arteriosclerosis of intramyocardial arteries. Multifocal myocardial necrosis. Myocardial fibrosis. Biomarkers. NT-proBNP correlates with disease progression. Altered serotonin, 5-HT, signaling implicated in pathogenesis. Endocarditis, dogs. Etiology. Streptococcus spp. Bartonella spp. Especially aortic valve. E. coli. Occasionally Erysipelathrix tonsillarum. Key points. Mitral valve most commonly affected. Often associated with polyarthritis. Bartonella endocarditis often aortic valve predominant. Exam trap. Bartonella equals culture negative endocarditis, requires PCR serology. Idiopathic pericardial effusion, hemorrhagic or serosanguinous. Signalment. Large giant breeds, Great Dane, St. Bernard, Great Pyrenees, German Shepherd, Golden Retriever. Diagnosis. Diagnosis of exclusion. Must rule out neoplasia, especially HSA, trauma, infection, coagulopathy. Lesions. Thickened pericardium. Fibrosis. Neovascularization. Lymphoplasmacytic plus histiocytic infiltrates. Mesothelial hyperplasia plus or minus denudation. Exam trap. Idiopathic pericardial effusion is common and often hemorrhagic, but not neoplastic. Hemangiosarcoma, HSA, and hemangioma. HSA. Most common primary cardiac tumor in dogs. Breeds, Golden Retriever, Classic, Maltese, Miniature Dachshund. Location, right auricle, right atrium. Gross, red to dark red blood-filled masses. Rupture hemopericardium plus tamponade. Metastasis, lungs most common. Histology. Neoplastic endothelial cells. Irregular vascular channels. CD31 or factor VIII, related antigen positive. Hemangioma, benign. Well circumscribed, blood-filled vascular spaces. Common in skin. Medial necrosis and hemorrhage, drug-induced. Cause. Vasoactive drugs, seen in toxicology screens. Lesions. Necrosis of smooth muscle cells in tunica media. Hemorrhage into vessel wall. Healing fibrosis. Exam trap, occurs in muscular arteries, especially epicardial vessels. Segmental arterial mediolysis, SAM. Cause. Agonists, e.g., ractopamine. Agonists. Catecholamine surge NE release vascular injury. Lesions. Occurs in splanchnic muscular arteries and coronary arteries. Medial smooth muscle apoptosis. Hemorrhage into media. Catastrophic arterial rupture possible. Healing fibrosis. Exam trap, SAM equals non-inflammatory, segmental medial destruction. Medium white star ACVP phase 2 exam tips for this section. MVD equals mysomatous expansion of spongiosa plus fibrosa disruption. CKCS equals 100% affected by age 10. Jet lesions equals endocardial fibrosis from regurgitant jets. Chordae rupture acute pulmonary edema. Left atrial rupture hemopericardium. Bartonella equals aortic valve, culture negative. Idiopathic pericardial effusion equals large breeds, hemorrhagic, non-neoplastic. Right atrial HSA equals classic cause of sudden tamponade. SAM equals agonist, induced medial apoptosis, not vasculitis. Vascular, thromboembolic, and lymphatic disorders. ACVP phase 2 high-yield rewrite. Fibrocartilaginous embolism, FCE. Core concept: fibrocartilage from degenerating intervertebral discs embolizes spinal cord vessel spinal cord infarction. Signalment: middle-aged large and giant breeds. Also reported in young Irish wolfhounds. Mechanism: fibrocartilaginous fragments enter arterial or venous spinal vasculature. Occlusion ischemic necrosis of spinal cord segments. Clinical: per acute onset posterior paresis paralysis. Non-painful after initial event. Lesions: emboli of fibrocartilage in spinal vessels. Infarction of affected spinal cord region. Exam trap: FCE equals non-inflammatory, asymmetric, per acute, non-progressive after 24 hours. Pulmonary artery thromboembolism, PTE. Incidence: -0.9% in dogs over 10 years. Predisposing conditions: anything causing hypercoagulability, endothelial injury, or stasis. Sepsis. IMHA. Neoplasia. Protein-losing nephropathy amyloidosis. DIC. Cardiac disease. Hyperadrenocorticism. Dirophilariasis. 4 catheters. Key points: thrombi may lies within hours absent at necropsy in (15%). Large thrombi in main pulmonary arteries equals more diagnostic. Exam trap: PTE is often suspected clinically but not found at necropsy due to rapid lysis. Arterial thromboembolism, ATE, and thrombosis. Most common site in dogs. Aortoiliac trifurcation, classic. Other sites: subclavian, brachial forelimb lameness. Coronary arteries. Renal arteries. Intestinal arteries. Causes: Spirocerca lupi. Blastomyces dermatitidis. PLN, hypothyroidism, hypercortisolism, diabetes mellitus. Aortic neoplasia. Exam trap. Unlike cats, dogs with aortoiliac thrombi often have less dramatic ischemia due to collateral circulation. Femoral artery thrombosis, CKCS. Signalment. Cavalier King Charles Spaniels. Key points. Partial or complete occlusion. Clinically insignificant due to excellent collateral circulation. Likely due to arterial wall weakness. Exam trap. CKCS femoral thrombosis not equal to feline saddle thrombus, no acute ischemic limb syndrome. Heartworm disease, Dirofilaria emitis. Prevalence. Dogs, 35 to 45% in endemic regions. Cats, -2%. Pathogenesis. Adult worms lodge in pulmonary arteries later RVRA vena cava. Causes pulmonary hypertension RV hypertrophy right-sided CHF. Vascular lesions. Endarteritis. Eosinophils infiltrate intima. Irregular fibromuscular intimal proliferation. Rough, granular, shaggy luminal surface. Thromboembolism. Pulmonary infarction. Caudal lung lobe pleural hemorrhage, hemosiderosis, fibrosis. Caval syndrome. Massive worm burden filling RA plus vena cava. Sudden collapse, hemolytic anemia, liver failure, shock. Requires surgical removal. Exam trap. Heartworm endarteritis equals fibromuscular intimal proliferation, not fibrinoid necrosis. Polyarteritis, Beagle pain syndrome. Also called idiopathic necrotizing polyarteritis, juvenile polyarteritis syndrome. Signalment. Beagles, pet and laboratory. Young to middle-aged. Clinical signs. Recurrent fever. Weight loss. Cervical pain, stiff neck, stilted gait, hunched posture. Some dogs asymptomatic. Pathogenesis. Likely immune-mediated vasculitis. Lesions. Gross. Small-medium muscular arteries, thick, tortuous. Focal hemorrhage. Aneurysms. Thrombosis. Microscopic. Early, fibrinoid necrosis plus leukocytic invasion of intima and media. Chronic, panateritis with fibrosis. Exam trap. Beagle pain syndrome equals necrotizing arteritis, not meningitis. Primary lymphedema. Mechanism. Aplasia or hyperplasia of superficial lymphatics and/or draining lymph nodes. Signalment. Distal hind limbs. Non-painful pitting edema. Necropsy. Hyperplastic or absent popliteal lymph nodes. Distal lymphatic hyperplasia. Diagnostics. Delayed lymphatic filling on. Lymphangiography. Lymphoscintigraphy. Patent blue dye test. Exam trap. Primary lymphedema equals congenital lymphatic hyperplasia, not inflammation. Primary intestinal lymphangiectasia. Signalment. Rare. Lundy-Hunt predisposed. Clinical. Severe protein losing enteropathy. Wasting. Diarrhea. Ascites. Lesions. Lacteals. Fused. Blunted. Markedly distended. Lymphatics in intestinal wall, mesentery, and nodes distended with chyle. Pathogenesis. Unclear in dogs. Secondary forms, more common, due to obstruction from inflammation or neoplasia. Exam trap. Primary lymphangiectasia equals dilated lacteals plus PLE, not inflammatory bowel disease. Medium white star ACVP phase 2 exam tips for this section. FCE equals disc material emboli, per acute, non-painful after onset. PTE often missed at necropsy due to rapid thrombolysis. Dogs with ATE rarely show the dramatic ischemia seen in cats. CKCS femoral thrombosis equals incidental. Heartworm disease equals endarteritis with fibromuscular proliferation. Caval syndrome equals worms in RA plus vena cava hemolysis plus collapse. Beagle pain syndrome equals necrotizing polyarteritis, immune-mediated. Primary lymphedema equals lymphatic hyperplasia. Primary intestinal lymphangiectasia equals PLE with dilated lacteals. Diseases of cats ACVP phase 2 high yield rewrite. Hypertrophic cardiomyopathy, HCM. Covered in the multispecies section, the most common cardiomyopathy of cats, strongly associated with MYBPC3 mutations in Maine Coons and Ragdolls. Endomyocarditis, feline endomyocardial restrictive disease. Core concept, idiopathic inflammatory plus fibrosing disease of the endocardium and adjacent myocardium, often involving the LV outflow tract. Lesions. Thickened endocardium, especially near LV outflow. Mixed inflammatory infiltrates extending into myocardium. Chronic cases, dense fibrous tissue, fewer inflammatory cells. Functional consequence. Restrictive physiology, impaired diastolic filling, left atrial enlargement CHF. Exam trap. Do not confuse with HCM. Endomyocarditis has endocardial fibrosis, not concentric hypertrophy. Hemopericardium, cats. Most common causes. Rodenticide toxicity, anticoagulants. DIC, consumption of clotting factors. Exam trap. Unlike dogs, cardiac HSA is rare in cats. Hemopericardium is usually coagulopathy related. Hydropericardium. Causes. CHF, most common. Neoplasms, heart-based tumors, mesothelioma, lymphoma, rhabdomyosarcoma, fibrosarcoma. Uremia, systemic vascular injury, serous effusion. Pericarditis. Key cause in cats. Feline infectious peritonitis, FIP, fibrinous pericarditis. Local manifestation of systemic coronavirus-associated vasculitis. Exam trap. FIP pericarditis equals fibrinous, not suppurative. Arterial thromboembolism, ATE. The single most important vascular emergency in cats. Definition: embolic obstruction of an artery by a thrombus formed at a distant site, usually the left atrium. Most common cause. Cardiomyopathy, HCM, RCM, left atrial enlargement stasis thrombus formation. Other causes. Hypercortisolism, sepsis, DIC. Endocrinopathies. Most common sites. Aortic trifurcation, saddle thrombus, classic. Right subclavian artery. Renal, splanchnic, cerebral arteries, less common. Lesions. Distal limbs, dark red-blue, cold, edematous. Hemorrhagic ischemic neuromyopathy. Infarction depends on collateral circulation. Exam trap. Cats with saddle thrombus often present with acute hind limb paralysis plus severe pain plus absent femoral pulses. Feline infectious peritonitis, FIP. Mechanism. Mutated feline enteric coronavirus. Immune complex vasculitis phlebitis, periphlebitis. Multisystemic disease. Lesions. Pyogranulomatous inflammation. Vasculitis in many organs. Effusions, wet form, or granulomas, dry form. Exam trap. FIP vasculitis equals phlebitis, not arteritis. Heartworm-associated respiratory disease, HARD. Key concept. Cats often have few or no adult worms, but still develop severe pulmonary vascular and airway disease. Lesions. Gross. Shaggy, roughened large pulmonary arteries, especially right caudal lobar artery. Small pulmonary artery emboli, infarcts, hemorrhage plus necrosis. Microscopic. Villus endarteritis. Medial hypertrophy. Type 2 pneumocyte hyperplasia. Eosinophilic perivascular inflammation. Clinical. Asthma-like syndrome. Sudden death in acute embolic phase. Exam trap. Cats rarely develop Caval syndrome. Disease is mostly pulmonary, not cardiac. Foreign parasitic diseases. Cats. Gultia paralisans, South America. Adult parasites in lumbar veins. Severe thrombophlebitis. Spinal cord damage, hind limb paralysis. Brugia SPP. Tropical regions. Infect lymphatic vessels. Cause secondary lymphedema. Diarofilaria immitis. As above, hard. Exam trap. Gultia equals venous thrombophlebitis of spinal veins, not arterial disease. Medium white star ACVP phase 2 exam tips for cats. HCM equals diastolic failure, left atrial enlargement ATE risk. Endomyocarditis equals endocardial fibrosis, not hypertrophy. Hemopericardium in cats equals rodenticide or DIC, not HSA. FIP equals immune complex phlebitis. Saddle thrombus equals ischemic neuromyopathy, cold painful limbs, absent pulses. Hard equals villus endarteritis plus eosinophilic pulmonary inflammation. Gultia equals lumbar venous thrombophlebitis spinal cord injury. Brugia equals lymphatic obstruction lymphedema.